and welcome to the August 24th, 2021 meeting of the Lane County Board of Commissioners. We are all present, although Commissioner Bozovich is with us remotely by phone. At this point in time, we have a lot of work to do. Let's jump into the agenda. Item number 1, are there any adjustments to the agenda? Seeing none. Item 2, is there emergency business? Seeing none. To the public watching the meeting, when you registered to watch in this temporary, doesn't feel temporary, does it? I'm sorry. In this temporary virtual format, you were registered in our system as attendees. Attendees are webinar participants who are audience members viewing the meeting. Your microphone and your webcam are automatically muted as attendees, but now we're opening the meeting for public comment. If you wish to participate in public comment, please raise your virtual hand to be recognized by our moderator, Diana Jones, by pressing the hand icon. When public comment begins, Diana will call names. When your name is called, you will be unmuted and given up to 3 minutes to make your statement. When your 3 minutes are up, we will let you know. We will ask you to go back to muted status so the next name can be called. The intent is for everyone that wants to speak to the board to be able to speak to the board. You can then continue to watch the webinar as long as you choose, and we'll try to give everyone who wants to speak that opportunity to do so. Ms. Jones, at this point in time, do we have people wishing to make public comment?
Thank you, Chair Bernie. At this time, we are opening up public comment. I do see that we have people registered. If you wish to give public comment, please raise your virtual hand now. Please only press the hand button once because it is a toggle and it will take your hand down if you press it more than once, and I won't know you would like to speak. With that, I will begin our public comment. I do see I see 3 hands up at this time. I will begin with Chris McAllister, followed by Andrew Black. Chris, I will unmute your microphone and you may begin your public comment. I show you are self-muted, Mr. McAllister. There you go.
Good morning. My name is Chris McAllister and I'm in District 2, Mr. Chair's district. I come before you today for a couple of reasons. I would first like to thank Elizabeth Migloretto, who has consistently gone to bat for our most vulnerable and saw our most people with open eyes. I also want to share my appreciation for Mr. Steve Adams, who rallied this weekend to help people in a way we have not seen since our initial pleas. We feel safer knowing that these 2 people are hearing our voice. The numbers don't lie, which is why we need more. I was turned away from testing with ID, doctor's recommendation, and insurance from 3 of the most recommended options from our public health line. We need more. Our unhoused without insurance, without ID, and with doctor urging are going to our hospitals because our U of O options, our mobile clinics, and our pop-ups are not adequately covering the need. Last week, our recommendations stated here in February of this year and May of last year were repeated by the CDC. Your local small providers and in-house epidemic specialists were backed by the CDC in ways that were not reflected by those they were advising or serving. I have a solution for 2 of the main issues, but we need a new drive, open minds, and a safety net that does not get undermined. It will take a new approach, but I believe in your expediency because our lives and those we serve depend on your response today. Let us provide HMIS IDs for our clients. We have an entire population and their helpers required by a federal mandate and local funding to be in a vetted database. This database allows us to print IDs, and we have even the equipment here in the county. You have dozens of staff members who are trained and registered and required to know what that is. We need transitional campgrounds, as clarified 2 years ago by HB 2916, in every ward and for every rural community in your governance. Recent legislation requests to ask how to better support this single piece of legislation when there are House bills like HB 2001 that looked at housing needs but did not cover our unhoused. And it was modeled off of one of our examples here in Lane County, Opportunity Village. Local government approval is the only missing part in this county, according to the state representative, Ms. Marsh, who wrote the bill. Not only does it fit your strategic plans to build 18-month short-term sites, It utilizes targeted service delivery such as county outreach workers, inter-system referrals, but also builds a stopgap for the coming navigation centers and permanent supportive housing. We can't wait. As of Friday, after over a year and a half of prevention, isolation, and relative safety went away for our team, our exposure from untested bottlenecks created by unplanned for sweep consequences and required interactions from contracting services without the requested and begged for safety mechanisms, now reinforced by the CDC, has over a third of my staff sick, in isolation, and with fatigue. Our entire top leadership has had fewer days off since March 31st, 2020 than I have fingers on these two hands. Half of my staff right now is being tested for COVID while in charge of protecting the most vulnerable unhoused to COVID. We built sane prevention models based on science, and we were told to be understanding and patient. Our people are now patients in the underserved system. The peoples you are depending on to serve without vaccines in the beginning, without testing almost the entire time, and without access to providers when our folks started falling, need more elected direction, more informed amendments, and fewer monolithic single supplier supports for the thousands who need the information.
Mr. McAllister, your time has expired.
We need an amendment. Please give us campgrounds. Please give us the IDs. Our people need to have access to testing. Thank you.
Thank you for your public comment. We will now go to Andrew Black, followed by Derek Ross. Andrew, I will unmute your microphone and you may begin your public comment.
Yes, hi. My name is Andrew Black and I'm a lifelong Lane County resident. I live in the North Eugene District 4, where Pat Farr serves as our county commissioner. I'd like to express my appreciation to each of the county commissioners for the work they do on behalf of Lane County residents. 2.5 weeks ago, I emailed each of the county commissioners 2 questions. 1, after the FDA fully approves Pfizer and/or Moderna COVID vaccines, will you support government mandates requiring COVID vaccination for eligible individuals? 2, will you support the implementation of a vaccine passport system in Lane County? Of the 5 commissioners, only Commissioner Jay Bosevich definitively answered these 2 questions. Yet these issues are impacting Lane County residents, and I think we deserve to know where all our elected officials stand on these issues. The current trend appears to be increased authoritarianism in government, more mandates, and more restrictions placed on county residents, all in the name of public health. Governor Brown has mandated that all state agency employees get the vax or lose their job. She has mandated that all healthcare workers get the vax or lose their job. And she has mandated that all K through 12 school employees get the vax or lose their job. Is it ethical to cancel another person's livelihood because they don't want to inject themselves with a vaccine? Does the state government own your body? Who has the authority to decide what goes into your body? Does consent even matter anymore? Do any of our elected officials think it is unethical to mandate a COVID vaccine? The director of the CDC recently stated that the COVID vaccine's ability to prevent infection decreases over time. And now the CDC is suggesting a booster shot. Will booster shots be mandated next? Aren't vaccinated adults also able to transmit the virus to each other? The Lane County Public Health also wants local businesses to embrace a vaccine passport system. They want you to accept and embrace a vaccine passport system too. But will a vaccine passport system set up a 2-tiered society where the vaccinated can participate fully while the unvaccinated are excluded and shunned? When will the vaccine passport system end? Or is it intended to be a permanent system of control? Which public health policies make our community safer? And which ones will divide our community and make people fear their neighbors? The weapons used to fight coronavirus can cause collateral damage to our community. I apologize for asking so many questions. I'm asking questions because I hope the county commissioners will slow down and reflect on whether vaccine mandates and vaccine passports are ethical.
Thank you for your public comment. Our next speaker is Derek Ross. Derek, I will unmute your microphone and you may begin your public comment. Derek, I do show yourself muted. you should have a button somewhere on whatever device you're using to unmute yourself, Derek, but right now you are self-muted.
Okay, sorry about that,
There you
just
go.
found it. Okay, thank you so much. And I just wanted to add my great appreciation for Andrew's words just then. I support each and every one of the words he said, and very, very good points to bring up. I'm hoping mine might lend some weight. The recommendation that mask requirements be increased is folly. Outdoor transmission has been proven by multiple studies to be between 1% and 2%. These are studies from around the world. Masks suppress only 60 microns and higher in size, whereas the largest COVID particles are 52 microns in size when aerosoled and lower. N95s for all would be impractical, and over a long enough period of time, they also fail to hold back all the aerosol particles. Thus, masks are not a permanent solution. Furthermore, both the bacterial feedback and social leprosy that wearing masks causes are harmful to individual humans and us as a society. The harm both of these effects is having on children is unprecedented, and their harm will be seen well into the future beyond the massive upscaling of self-harm and suicides they are experiencing already. Any increase in vaccine-mandated activities or restrictions on individuals without will be judged as unconstitutional in the near future. Do not be the county that would fall in line with this major mistake in discriminating against people's personal medical choices. Show support and understanding for those who would choose their path toward actual health, a word that has had its meaning twisted in the last 20 months to where our public health agencies have declared single solution magic bullets. Remember, these brand new vaccines are not cures, they are symptom reducers only. There is still no cure for any virus. Natural immunity will be reached by all people on a long enough time scale. We must embrace this truth about such a contagious virus. Finally, my most important point today is be prepared to declare SARS-CoV-2 endemic. The country of Norway has done this. The state of Iowa has done this. Be a leader in the state of Oregon by declaring this virus endemic to our society, as we have very robust ways to deal with specific disease on a person-by-person basis. Help to promote a proactive approach to awareness about vaccinated resistance and natural immunity working together, along with diet, exercise, and mental health to protect the most vulnerable populations to this COVID-19 disease. Support your vision and core behaviors of Lane County as set forth in the strategic plan, and lead us with more permanent solutions, not these reactions to fear and hysteria. Promote bravery and stand out and make us proud. Thank you for your consideration.
Thank you for your public comment. At this time, I do not show any additional hands raised. So if you have registered for public comment and would like to be live, please please raise your hand and I will call on you. I'll give you a few more moments to see if we get any other people. And I am not seeing any additional hands go up, so I will return the meeting to you, Chair Bernie.
Thank you very much, Diana. Thank you very much, everyone that spoke. This is the opportunity now, after public input, for commissioners' response to comments and/or other issues and remonstrances. I know that Commissioner Bozovich's reception is spotty. Commissioner Bozovich, are you still with us?
Yes, I am, Chair. Thank you. First, I'd just like to apologize to my constituents and the citizens of Lane County for missing the full board meeting today. I've missed very few meetings over my tenure, but this summer has been a very strange summer for everyone, and included knee replacement surgery for my wife, shortly followed by the passing of her father, which caused us to postpone the vacation till now that we had planned for the summer. But I just wanted to take a minute to state a couple things. First, I want to state my support for the emergency action under the public health item. It is an advisory, it's not a mandate, but I do believe that we are seeing serious increases in COVID numbers that have to be taken seriously. Second, I'd just like to note that I support the ban on the use and discharge of fireworks in unincorporated Lane County. but I do not support a ban on the sales and manufacturing. And I'm expecting that you'll hear some testimony from some folks later this afternoon about that. So if the language remains, including the sales and manufacturing, you can count me as a no vote on that one. And with that, I think I'll just say, again, my apologies to everyone for having to miss the meeting. Wish I could be there, and I will probably sign out shortly because I'm this is the gathering spot for people to get their email, and everyone's having to listen to the board meeting and my conversation right now.
Oh, heck, Commissioner, tell him it's good for him. No, I'm just kidding you. Commissioner Bozovich, if you would be kind enough to text me and let me know when you're out. Until then, I'll call on you as appropriate.
All right, thank you.
Thank you. Are there any other commissioners now that would like to make a remonstrance or other issues? Yes, Commissioner Buck.
Thank you, Chair. First, I'll just appreciate everybody calling in and giving public testimony today. I wanted to take a moment to share, as some people have heard, yesterday we had a death from a firefighter who's working on the Gales fire in the Middle Fork complex. I want to extend my profound sadness and condolences to their family and to the firefighter family at large. This goes to show just how extremely dangerous the conditions are in which they work. And we just so appreciate what our firefighters do every single day on our behalf to keep our communities safe. I'm so very sorry to hear of that death. Thank you, Chair.
Thank you, Commissioner Buck. Are there any other commissioners? No? Oh, yes, Vice Chair Farr.
Thank you, Chair Bernie, and Commissioner Buck. Thank you for pointing out the tragic death of the firefighter in the Middle Fork complex. As a former firefighter myself, I only worked cleanup, and that itself was uncomfortable, but not as dangerous as what the men and women who are on the front lines are facing on a daily basis. We all have to give our deep thanks, deep appreciation for the work that they are doing, while we sit here enjoying the freedom of not having to fight a fire. So thank you for bringing that up, Commissioner Buck. And Chair Bernie, I will mention this during the Board of Health meeting also, and I'm going to mention it right now just to get a little bit more, a larger number of people hearing what I have to say. We all have stories regarding how COVID has touched our lives. Everybody does, and those stories are expanding, multiple stories. One touched me deeply yesterday. I graduated from Tillamook High School in 1972. Our quarterback was an all-state quarterback, became an All-American quarterback for Portland State University, broke many records while playing football for Portland State University. He was Mike Gardner was a tremendous athlete, a good father, a good family man. Yesterday morning, he passed away from COVID-19 in Tillamook County General Hospital. That's a story. We all have stories. This is another story that touches me very, very deeply because this is a man who I first met when I first came to the United States. He's strong, athletic, in good health, was just elected to the Tillamook County School District 9 Board of Directors and passed away yesterday morning. Once again, we all have the stories, but sometimes it touches ever so close to heart. Thank you, Chair.
Thank you very, very much, Commissioner. Yes, Commissioner Trieger.
Thank you, Chair. I appreciate folks who called in, and I wanted to specifically respond to Mr. McAllister and just let him know I am working to set up a call with one of your community partners who reached out to me about a conversation you had with them about this challenge of testing for our neighbors who are unsheltered. And the added layer that you added about the need for acceptable ID and so on was a piece I wasn't aware of. So I just want Mr. McAllister to know that just as with vaccine uptake, there are extra challenges and resources we're going to need to commit to do our part to serve that particularly vulnerable community who we as a society writ large have already failed in so many ways. And now with the variant surge and the need for more frequent and regular testing, we're going to have to put our heads together and figure out ways to do that once again, and particularly as we head into the colder, wetter months when more folks are going to be inside or forced to stay outside in ever more challenging conditions. I just want Mr. McAllister to know that I heard his comments, share his concerns, and looking forward to working with my colleagues and with staff here to do whatever we can to be part of the solution to supporting our most vulnerable unsheltered neighbors. Thank you, Chair.
Thank you very much, Commissioner. I also would like to thank Mr. McAllister, Mr. Black, and Derek. I apologize, I didn't catch your last name, but all three of you for providing input. I'm constantly amazed with the issues that we all are dealing with in our lives these days, that we don't have 40 or 50 people providing input because there is so much. I'm going to just share that I've now lost 2 to COVID. At the beginning of the epidemic, my aunt, who was elderly, and very recently, a dear friend who was 51, an African-American who was really one of the premier sort of unspoken heroes to hundreds, if not thousands, of young boys and girls in Lane County as a coach, as a mentor, and 18 years ago when my wife passed away, he helped my son get his head back into life from that level of loss. So now we, Kim Price, we honor you, and your loss has touched me and my son, who shed tears over it literally days after he gave birth to his first child. So it's touching all of us. But I thank everyone for their perspective and the sincerity with which they presented input, and everyone needs to be listened to and heard. Are there any other commissioner responses before we get into county administration? Okay, we're now on item 5, county administration. These are going to be a couple of pretty imperative updates we get. First, Lane County Fire update, and I believe Patience Winningham Melcher is going to present information to us. Patience.
Good morning, Chair Bernie, commissioners. I was hoping I could share my screen, Diana. Does that work? Can you see my screen?
We did for a minute there, and then it scooted back off the screen. There you go.
Okay, thank you. I'll have to move the cameras over here so I can see your faces. So Commissioner Buck, thank you very much for bringing up the fatality yesterday on the Middle Fork complex. It's much appreciated that elected officials handle that difficult discussion. We were able to respond to the incident command post, which is currently at the fairgrounds. That's the Royal We. So the sheriff's office, myself, and some other staff went to support the incident management team in their response and recovery efforts to support the firefighter crews that were being brought out of the fire zone. So I'd like to start off with the Rough Patch Complex is a fire that's actually happening in the Douglas County right now. It's a forgotten fire, but it was a part of many fires. The Jack Fire, you'll recall, they've gotten that pretty much contained. But within that footprint is the Chaos Fire, and the Chaos Fire is burning right around the Bohemian Mines area, and I understand that Lane County Parks has a small footprint out there. It continues to burn, but currently there are no impacts to infrastructure or community members. So I won't talk a lot about that this morning. Currently, the incident management team, which was a type 1 team, Pacific Northwest Team 3, had left on Sunday. That was a team that came with many resources, upwards of 75 staff, command and general staff that worked in the incident command post. They were here for roughly 14 days, and they transitioned down to a type 2 team. And the type 2 team is the Pacific Northwest Team 13, and the current incident commander is Brian Gales. Currently, they're hosting daily cooperator meetings in coordination with the Sheriff's Office, who's monitoring evacuation levels. I believe Commissioner Buck is integrated in those, as well as Mayor Holston for the City of Oak Ridge and the City Administrator. So we're all very much in tune to the situation and the fires, and we continue to make a downward trend of staff and resources needed to support this fire, particularly because there are other fires around the nation that are starting to take higher priority. And I'll get into that here a little bit more. But what I'm showing here is an example of a report that is provided to us daily. So this is one example of a situation update that we get. We can get these off the fire website, NCWeb. Happy to share the link with the board if you're interested. Try not to inundate you with too many emails unless it's absolutely necessary. But I know the Commissioner Buck receives the information she needs from the group as needed. And if there were any needs for additional information, we would certainly push that out. If there were a fire in your districts, I would do the same thing. I would be providing you as much information as available to me and answer any questions. I can tell you that this is a team that's here to support the response in fire suppression for the Forest Service. This fire is primarily in federal land with coordination of Bureau of Land Management, and there's a small footprint for Oregon Department of Forestry. So it's a coordinated effort in fire suppression. Our piece of the pie for me really is helping with the law enforcement piece, with the impacts to the public and critical infrastructure, and making sure they have all the access to the tools and resources that they may need. So this is the footprint currently for the Gales fire. The team produces these maps on a daily basis, and they send them out to emergency managers and the cooperators list, which is many, which includes the fire chiefs within the impacted area, law enforcement, the Board of Commissioners, and we use these to build evacuation zone information, to understand fire growth and fire behavior. We also get briefings that talk about the weather changes for the next 7 to 10 days. They're always leaning forward in forward planning for potential fire behavior. So if you'll all recall, last week we saw that big smoke column stand up, and everybody got really nervous and thought maybe there was extreme fire behavior and fire growth. The best part about that was it was planned. The team knew that was going to happen. It was intentional. We were able to quickly turn around and working with our public information officers to share that information with the public and help dispel any rumors and make sure everybody clearly understood that this was expected and anticipated. The team currently is continuing to work on fire suppression here on this north side. They've got a lot of staff working on reinforcing those lines, and they also have staff down here on this side reinforcing those lines to mitigate a fire spread. This is the Quist fire, and the Quist fire was took up a lot of the county resources and a number of coordination and collaboration for many resources. Staff, Oregon State Fire Marshal's Office sent the red team, the Oregon State Fire, was it the Incident Management Team 2? And they came down and they basically helped us look at all the infrastructure, all the homes, all the residents, and they looked at them for a structure for fire risk, and basically assessed them, marked them, made sure that they were all ready to be defendable should the fire encroach upon those residents. This black line around the fire means that these are all the areas that have been fully contained. You'll see here there's a little red mark, and this is where they're really focusing on some of their effort to button that fire up. So close the door on the Quist fire. The search and rescue, the technology services, county roads, the sheriff's office, dispatch worked daily to look at the residents within the High Prairie area, within the West Fur area, and we looked at the structures to better understand the assets at risk. That helps inform the way ahead and the conflagration. So when we do get resources from the State Fire Marshal's office to support us, this was a little bit different in that, you know, they generally release those resources in a conflagration when houses are burning down. We had the opportunity here to really mitigate that risk before the fire spread. So it was really pre-planning and front-loading those task forces. We had 4 task forces that came to the area to help support that community, help inform them, and help pre-plan their potential evacuation. This is a map that through coordination of many, it's an example. This may be an older version, but I want to show you the amount of effort that goes into pre-planning and developing evacuation zones, management action lines, management action points, and how we would move people and how the team makes decisions on moving those people. So you'll see here, there's the green line. That's really that get ready line of, okay, if the fire makes it to this far, this is when we're gonna put everybody on a get ready notice. Or the yellow line is a level 2. We're gonna be ready to leave at a moment's notice, and level 3 is the red line, right? So we continue to do that with our partnerships with technology services. Our GIS crew is phenomenal. We share this information up to the state, and then we also share it with the team. So we took our staff and integrated with the incident management team that's responsible for the fire suppression, and they're able to put all of these plans in place to be able to move swiftly or quickly in an event should the fire have spread. Currently, we only have a level 3 in place, and this is primarily around the Road 18. It's mostly national forest. There's campgrounds, recreational folks, and that's the closure here. Some of this has now moved into the Willamette National Forest Road 19, where the closure has been extended to keep people from going up into the wilderness and hiking and us not being able to move them quickly if we had to. And then down below here, this is the Quist fire and the evacuation zones. It's hard to see, but I just wanted to provide an example for you to see exactly the effort that goes into some of this work. Another thing that's really happening behind the scenes that I'm not sure the board is aware, they do have air quality specialists on the team that are working closely with LRAPA, the Lane Regional Air Pollution Agency, and they review the air quality every day and produce this report that talks about the areas that may be of concern and reviewing the air quality. We're working directly with Lane County Public Health, who has air monitors, air purifiers, cleaner air equipment that we've deployed to Oak Ridge and Mackenzie Bridge, so that when they do hit these very unhealthy days, we're able to provide those facilities and those resources to those jurisdictions. I also want to remind the board that it's a force of many. When events like this happen, not just wildfire, but snowstorms, COVID, the whole 9 yards, there are many people that are really putting their best foot forward. The COAD, Community Organizations Active in Disaster, is a solid group here in Lane County, and they are all made up of nonprofit, faith-based organizations that have continued to support us for cooling centers, for smoke respite facilities. They have provided volunteer and donations management support in the Holiday Farm Fire. They are comprised of a force of many, and I just want to recognize them and be sure that the board knows that they have really helped us in our worst day. They do have a website, which is preparelane.org, and I'm continuing to direct folks that ask, how can I help? If they come to us from a church or another nonprofit agency and they're looking to support or assist in some way, I direct them to the COAD, which adds them to the list of memberships, and we provide training to them on a quarterly basis so that they can better understand how we work at the county level, at the local city level, and how they can support us and our communities in recovery. Search and rescue has been an amazing tool in our box, and they are also filled with volunteers. And I couldn't say it enough that without Jason Bowman and Tim Chase, we couldn't do a lot of the things that we do today. They're really well tuned in the GIS models, and drawing those evacuation zones is extremely important and beneficial and informative, and they have really risen to the occasion, and I look forward to working with them throughout the rest of my career. Again, I wanted to bring to the board the Oregon State Fire Marshal's Office, the RED team. They are a Type 2 incident management team. They were deployed here during the Holiday Farm Fire, and they had the advantage of being deployed again to help us mitigate risk for the Quist fire. They were able to integrate quickly. They've already had the relationships in place. It was easy to get them on board and start working together to pre-plan should we have potential impacts for the city of Oak Ridge. We were also able to work pretty closely with the City of Oak Ridge Police and Fire. So search and rescue went, when we moved to level 2s, they went and did walk-in knocks. So they knocked on the doors of every person that was in the level 2 zone, and they were able to do that within 4 hours. 4 hours after we released a level 2, they knocked on every single door of every homeowner and asked if they needed assistance. And if they needed assistance, the City of Oak Ridge stood up a website where they started collecting information for every person that may potentially need assistance. We also worked with Lane County Disability Services. We worked with Senior and Disabled Services. We worked with Home Health and Hospice, and coordinated with their clientele to pre-plan transportation and evacuation plans, and then alternate sheltering options, including working with the Red Cross. The Sheriff's Office has been in every briefing, providing community information every step of the way with their command staff, and that again is much appreciated, and their support has been unprecedented. And lastly, I want to remind the board, I've already talked about this a few times, but our GIS staff is top notch, and they're always looking for ways to make it more seamless, make moving people, do the evacuation planning, drawing zones, and sharing that information. What are the primary residents? What are the tax lots? There are a lot of tools or attributes that go into the pre-planning for events like this. We'll continue to make those much more robust, those planning tools, and I again look forward to working with GIS to do that work. I do want to remind the board that we did declare a drought, or we requested a drought emergency from the governor's office back in May or June. It was accepted and approved, and we were added to the state declaration for drought. You can see here that Lane County has moved into the D4 conditions, and D4 conditions are exceptional drought. I provided the URL up here on the top of the slide, so those of you that are interested in looking at that in greater detail, there is a slide deck out there, and you can definitely dive more into that. But you'll notice here on this map, it shows the exceptional drought area, and this continues to be bigger. It continues to grow. In the fire briefing yesterday or the day before, the incident commander had brought up how they're seeing very dry fuel. So a tree had fallen on the ground, they'd cut it down 48 hours before, and it was so dry the stump was burning 48 hours later. So it just shows you how stressed the forests are and how extremely dry it is out there. So my message to my team, my emergency management team, our emergency management committee, is that we aren't out of the woods yet. We still have probably 6 to 8 weeks of fire season to go before we really see any sort of measurable rain or relief. So stay on your toes and stay prepared. This is a hazard situation overview. This is a website. I have a URL here to share with you, but you'll notice across the top, it talks about hazards overview, COVID cases, the weather, drought, earthquake, fire activity, flood forecast. This is really a situational awareness, common operating picture tool that is available statewide, but you can also draw down to specifically to the county level. Across the bottom here is hazard overview, COVID case map, fire map, drought map, earthquake map, and the like. This is a great tool that leadership can use to get information that's really been aggregated for you and mapped. On the end here, it shows the FEMA daily operations briefing. That's nationwide. So if you click on that, there's a really nice PDF that talks about what's happening in Tennessee, what's happening in New York. And that's really informative to see how other parts of the country are being impacted by extreme weather behavior. Here's the URL that you can jot down for those of you watching or the board members. That'll take you to that dashboard, and that is a public dashboard. With that, I'll stop there for any questions about current wildfire.
You're on mute, Chair.
I think you might be muted, Chair Bernie.
Thank you. I have contributed to us going a bit over on this item. So are there any questions or comments from commissioners for patients? Yes, Commissioner Buck.
Just quickly, we have those 10 o'clock cooperators meetings every day. And of course, I'll be here in our board meetings. So if you don't mind, if you could please share my condolences with the crew on the death of the firefighter at your meeting today, that would be most appreciated.
I think Carl and I are dividing and conquering.
Thank you, Commissioner. Commissioner Trieger.
Thank you, Chair. Thank you so much for this presentation. It's really, it's helpful and it's upsetting. But really appreciate the clear information, the great maps, really helpful to see the evacuation zones as the fire line moves, things like that. Just appreciate that as a visual thinker. Also want to appreciate the Facebook Live updates that happen. I've found those a really great way in real time to feel like I know what's going on and can always go back into the video section of the complex page to find those. So really appreciating just all the ways you and your team and all the partners are reaching out to keep community informed and educated. I have one very quick question. You mentioned, or one of the slides in the narrative talked about unauthorized motorists really impeding safety and progress of firefighting efforts. Can you give us a sense, is there a particular theme? Are people coming just to sort of gawk? Are they trying to recreate? What's happening, and is there anything we can do to communicate with the public about how important it is to stay out of those areas if they're an unauthorized to be there?
Yeah, I think that quite frankly, I think it's people looking to recreate in the area. They do have law enforcement that are supporting trying to keep people out of the way, but they are folks that are looking to recreate in those areas. And I did point out that they did increase the forest closure as of Sunday all the way over to the 19, which is Otter for Heidi. So that may help get some of those folks out of the way.
Okay, thank you very much. And again, thank you, and please stay safe, and appreciate your work so very much.
Thank you.
Thank you, Commissioner. Anyone else? Commissioner Farr, anything? Okay. Patients, very quickly, if I may, your slide on drought conditions, that's like a big deal, is it not?
Yes, I ran out of time last night, and I was really going to look at the last time, if ever, we'd ever had exceptional drought, but I didn't get time to look at the history to pull that forward for the board.
How many counties do you know have now declared drought conditions in Oregon?
22 are currently
22
approved.
out of 36 counties.
Yep.
And drought conditions, my understanding is just because we have rain, that doesn't immediately change the conditions of soil and moisture in trees. I mean, could you speak to that for a moment? How long are we in this?
Well, I know enough to be dangerous as far as the soil and saturation of the soil and how much precipitation we would need to receive to get out of the extreme drought or exceptional drought conditions. That's somebody else's question.
Oh, okay. I didn't mean to put you on the spot. It just really, it presses a lot of buttons in me because, right? I mean, now with trees gone and root systems not in place and soil dry like this, it just bodes, even when heavy rains come, we may be looking at a lot of earth moving. Is that correct?
Yes. Because of the Holiday Farm Fire, there were a number of federal teams that came together and produced a couple of reports. There's the ETART report, which is Erosion Threat Assessment Report that was put together by Bureau of Land Management, FEMA, and some other specialists. It's a probably 75-page report, which I'd be happy to send a link to the board, but it does call out many areas of concern, specifically in the McKenzie River watershed and potential runoff issues where we need to upgrade culverts and other public infrastructure to protect. It also goes into great detail on landslide risk in the areas.
Well, if I may, if commissioners allow me, if there are no other questions, let's segue into the next item that is also yours, which is item 5B. Order Resolution 21-08-24-01 in the matter of recognizing September as National Preparedness Month. Ms. Winningham Melcher.
Thank you, Chair. I'll make this brief but important. So historically, the Department of Homeland Security has designated September as Emergency Preparedness Month or National Preparedness Month across America. September 21 marks the one-year anniversary of the Holiday Farm Fire and also the 20th anniversary of 9/11, the terrorist attacks on American soil. So I'd like to recognize those events quickly with a few statistics, and then go into a National Preparedness Month and what our organization is doing. So September 11th marks the 20th anniversary of the terrorist attacks in 2001, where 2,977 people were killed. 19 hijackers committed murder-suicide and left more than 6,000 others injured. The United States and countries abroad will soon pause again to remember the tragic events of September 11th. On March 13th, the U.S. declared a nationwide emergency due to COVID-19. This pandemic has had and will continue to have long-lasting, wide-ranging impacts on nearly every aspect of our lives. Like few crises before, it will include impacts to economic, social, and our well-being and our overall way of life. On September 7th, will mark the one-year anniversary of the Holiday Farm Fire, where over 170,000 acres were burned in the McKenzie River watershed, displacing over 5,000 people, destroying over 1,100 structures and more than 400 residential buildings. At this time, I'd like to ask the board and those joining us virtually to take a moment of silence to honor those lost in 9/11. Remember the impacts of survivors of COVID-19 and those that were lost and impacted by the Holiday Farm Fire. Chair Bernie, may we take a moment of silence?
Absolutely.
Thank you. We all remember where we were on 9/11. It's probably something we'll never forget. We all remember where we were on the morning of the Holiday Farm fire and the aftermath. Something we'll never forget. COVID is here, and it's here for a long time. And National Preparedness Month is our opportunity to ensure that we continue to be prepared for our worst day, our next worst day. We as an organization are really working hard to cover those areas of preparedness, recovery, mitigation, protection, and prevention. Every day we're putting steps forward to do that. And during the month of September, our organization is focusing on emergency supplies for our staff members. So really bringing those things forward so that everybody can take the opportunity to recognize and reflect ways that they can be prepared as individuals, and ways that they can prepare their families and prepare their neighbors. The theme this year for National Preparedness Month is really about protecting yourself, preparing to protect, and preparing for disasters is protecting the ones you love. So I challenge the board to take an opportunity to prepare yourselves, ask your community members to be prepared, and look at ways they can prepare themselves and their families and working with their neighbors. And I ask the board to recognize those events in the month of September as National Preparedness Month. And that is the end of my presentation.
Are you sure? I'm just kidding. Yeah. Why don't we entertain a motion and speak to the motion at this point? Vice Chair Farr.
Thank you, Chair Bernie. I move Order Resolution 2108-2401 in the matter of recognizing September as National Preparedness Month.
Thank you, Vice Chair. Is there a second?
I'll second.
Thank you, Commissioner Buck. Commissioner Farr has moved and Commissioner Buck has seconded approval of Order Resolution 21-08-24-01. Is there a discussion towards the motion? Commissioner Buck.
I just want to appreciate all the work that you do in the Emergency Management Department. I know that you now have a couple extra staff there, which we all supported along the way. There's a lot of work to be done in a lot of agencies that coordinate together for emergency preparedness. And that's a big job, especially when what we're seeing here in these last few years. We came on board just a few months apart, and boy, has it been a lot about emergency preparedness and recovery. So I just wanted to give my huge appreciation to your work. The way in which you present your work to the board is so professional and so poignant. I thank you very, very much. It's my honor to be able to support this order and resolution. And I think I almost have everything on the list that we offer county employees to be prepared for an emergency. I'll have to come through and see if there's something I haven't gotten yet. And just wrote an article for the Sentinel on emergency response and what it means and how to be prepared. I think I'm a broken record at this point, but hopefully we as a board are showing others that this is deeply important. Thank you.
Thank you, Commissioner. Commissioner Farr.
Thank you, Chair Bernie, and thank you, Commissioner Buck, for those words. Patents, you mentioned in the last presentation that this is a force of many. While it's a force of many, every force needs a marshal. And when everything becomes quick moving, you have been the marshal. You demonstrate a clear ability to do such. In the last report, you talked about search and rescue, COAD, the Oregon State Fire Marshals, Red Team, City of Oak Ridge, LCSO, technical services, such a broad range in your force of many. You are the marshal. I salute you.
Thank you very much, Commissioner. Yes, Commissioner Trieger.
Thank you, Chair. Fully support this order and resolution, and just want to call out in particular because it feels very personal in the whereas about preparing each family member and pet for a 72-hour plan. I just took a short vacation, and I never would have dreamed that part of the notes I would leave behind for my house and cat sitter was where to find the go box for the cat, where the carrier was. And usually I leave the vet's phone number, but here's the box where there's a few days worth of litter and food and little travel containers for, it felt, you know, it both eased and amped up my anxiety at the same time to have to add that to my notes. But I want to remind people how important that is. Appreciate the efforts of the advanced livestock evacuation and support that we're able to provide at the fairgrounds for folks in the Middle Fork complex and other fire zones, that we're able to provide them some advanced support for getting larger animals out and sheltered safely. And I just want to say, because we're going to roll into our conversation about COVID on our agenda here soon, that those of us who have the resources and the ability to prepare really have to do so not only for ourselves, but for the broader community. Because like with COVID now, with the hospitals full of COVID patients, we need to be extra cautious in our recreational activities, in working around the house, in our driving, so that we don't experience an accident that requires medical attention and care that puts further strain on the system. And the same is true for those of us who have the resources to be prepared for emergencies. We owe it to those who don't have those resources and those opportunities to not become any extra strain on a already strained system in the event of an emergency. So there are so many in our community that don't have the ability that I had to leave a 72-hour well-packed go box for my cat, let alone for food and other supplies for our household. So I just really want to urge anyone and everyone who's watching this, if you have the resource and the ability to put a go box together for yourself, please do so, because it's going to help ease the burden on a strained system in the event of a large emergency or even a small one down the road. And it's just going to make your life better too. So thank you again so much for all your presentations, and thank you for giving us a moment of silence, and thank you for having a lovely photo on your screen share for me to focus on during that moment of silence. It really helped, and happy to support this order.
Thank you, Commissioner. I will simply quickly contribute that during the World Trade Center bombing of September 11th, which is something that you also mentioned, I remember every moment. I remember my children with me watching. I remember that's what motivated my oldest son to join the Army. It has impacted our lives. He had 2 tours of duty, one in the Middle East and one in South Korea. So this opportunity to not only sadly look at how this month has impacted our community recently and this COVID stuff, but also going all the way back to that, I appreciate very much. If there are no further questions or comments, I see none. I'm going to call the question. All those in favor of Order Resolution 21-08-24-01 in the matter of recognizing September as National Preparedness Month, made by Vice Chair Farr and seconded by Commissioner Buck, please signify by saying aye.
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 Opposed? Let the record show that Resolution 21-08-24-01 has been approved unanimously 4-0 by those commissioners present, Commissioner Bozovich absent. Thank you very much. Commissioners, we are now taking a recess from our Board of Commissioners meeting, and we are opening the Tuesday, August 24th, 2021 joint meeting between the Board of Health and the Board of Commissioners. Item 1 on this agenda, are there any adjustments to the agenda? Seeing none, is there any, although I will note that I've had trouble pulling it out, but we have a item 3B, just to make sure all commissioners have seen that, which is going to be in order. Is there any emergency business, Mr. Mokrahysky? No.
I'm not sure if we're calling item 3B emergency business. It was scheduled here in the last 24 hours. So that is an item that we'll take up after the update. And that's consideration of a board order related to an emergency public health advisory. We'll talk more about that in the update.
Right, and I apologize. That to me was.
If I may, we are calling an emergency business and it will be on screen after this next item.
Okay, thank you. Well, then let's dive into it. Mr. Adams and Dr. Warren, item 3A, COVID-19 response and recovery. We are listening with full attention.
Chair Bernie, thank you. Good morning, commissioners. A quick update from me on the current status of COVID-19 in our community. This morning, we are reporting a total of 19,445 cases since the inception of COVID-19 early last year. That is an increase of 178 in the last 24 hours. And that is an increase of 3,260 from my last update to the board 2 weeks ago. We are reporting 187 deaths in total since early 2020. That's an increase of 1 in the last 24 hours, and that is an increase of 12 since my last board update. We continue to see very high daily case reports coming in. Yesterday, we received reports of 299 new cases in a 24-hour period, and that was the highest one-day total. We have had over 1,000 individuals deemed infectious within Lane County for over 2 weeks now. We've crested 1,200 this morning. We're tracking 1,143. This morning, we're reporting 79 individuals in Lane County, 79 Lane County residents in hospital, 21 of whom are in ICU beds. And as the board will note from previous presentations, we continue to receive large numbers of transports from elsewhere in Oregon. So our numbers as of this morning, 126 current COVID patients, 46 of whom are in ICU beds. COVID patients are currently occupying 74% of our ICU beds. We currently have 22 COVID patients on ventilators, and that represents 34% of our total ventilation capacity within Lane County. The 7-day rolling rate per 100,000 is displayed here with yesterday's data, indicate that as of the last data point plotted, 374.7 cases per 100,000 of population. And just by way of comparison, 100 cases per 100K is the threshold for the highest level of transmission risk as deemed by the Centers for Disease Control. So showing then the epi-curve as we have been tracking this from the early March of 2020. This puts the current Delta surge into perspective against what we had assumed was the most challenging days of the winter surge this past winter, as an inclusive of the UK variant or Alpha variant, which hit us hard in April. We continue to climb up as we have new case reports coming in on a daily basis. I showed this table 2 weeks ago and show a refreshed version. This is statewide OHA data with regard to the hospitalization and give some degree of indication about severity as well. So The OHA visualization here, they continue to have to adjust the left-hand axis here to enable the upward swing. The dark orange curve on the top is total COVID patients in hospital. The middle curve there, the second one from the top, is total in ICU beds, and the light orange on the bottom is those COVID-19 patients on ventilation. So you see that in all three categories, we have surpassed the worst of the winter surge here in Oregon. And truly, our hospital capacity is stretched now as it has never been before. Turning then from the case inundation that is hitting us, I do want to report some updates with respect to vaccination. So we are seeing some evidence of increased vaccine uptake. So this slide is what I showed you 2 weeks ago as of the total number of individuals who had at least received their first dose. Updating that now with data current as of yesterday being reported by OHA, we see that 5,295 individuals stepped forward to receive their first dose in the last 2 weeks. This compares favorably to the entire month of July, in which we had 5,655 individuals in total step forward for a vaccination. So we are on track now to double in August what we saw in all of July, and we really are seeing a couple of underlying causes there. As the board knows, we received funding from OHA to provide various incentives supporting our equity efforts and our outreach efforts and efforts to get into rural communities. And we have rolled out over the last 2 weeks gift cards for $50 for individuals stepping forward to receive a vaccine. And that appears to be driving demand. We're hearing that anecdotally. We're also seeing increased interest and demand for vaccines, driven by, I think, the growing public awareness around the severity of the Delta variant. If we compare ourselves to other counties, comparable counties that are not currently offering incentives, we're seeing increases. So we're seeing both of those factors rolling in, and we're pleased to see increasing numbers of individuals receiving vaccination. As of yesterday, 61.7% of our total population has received at least one dose. And if you look at that against just the eligible population, and that is individuals 12 years old or older, the vaccination rate is 69.4% of individuals. So we continue to add numbers. In addition to the cases and the vaccination, so all of the work that the team here is doing on the ground, many changes in broader context. Monday, of course, yesterday, we received word early that the Food and Drug Administration had provided full approval for the Pfizer vaccine for individuals 16 and older. For 12 to 15, it remains under an emergency use authorization, but it is fully approved for individuals 16 and older. And we anticipate seeing additional developments on that front in the months ahead, weeks and months ahead. We have begun providing third doses as approved about 10 days ago by the Food and Drug Administration and the Centers for Disease Control for individuals who are immunocompromised. Those individuals and the conditions that qualify are well documented. We have begun to offer those doses eligible for individuals having received either Pfizer or Moderna, the two mRNA vaccines. And so we are seeing demand there, and we're hearing from some of our provider partners around Wayne County at pharmacies and other places that demand is moving forward. We also received additional updates from state government over the last 2 weeks' time. The governor announced last week a movement toward rulemaking that would require vaccinations within K-12 for teachers, staff, and even volunteers going on campus. And with a deadline of October 16th, or 6 weeks after, excuse me, an FDA approval, whichever is later. Further, healthcare workers, which that particular sector was initially slated to have a required testing protocol with a vaccination opt-out. And that rule is apparently being rewritten. The governor announced requiring a similar vaccination mandate. We're awaiting that rule. We have yet to see what that looks like in particular. We, since the board last met, and since you all acted on approving the emergency public health advisory, the governor subsequently announced a statewide indoor masking rule that was congruent with much of what this board called for here in Lane County. So we continue to see developments moving forward. And as we take those on board, we continue the work here on the ground to try to increase vaccinations. I have been showing the board at your request updates and progress on some of our vaccination efforts on the ground, and we are seeing increases in some of our priority zip codes. So 97402 has seen an increase of 2 percentage points over the last 2 weeks. 97478, these being our highest populace of unvaccinated individuals, has seen likewise an increase of 2 percentage points since I presented last. In areas with heavier vaccination rates like 97405, we see a slower uptake. So that's up. It's now 76.6, and it was 75.6 2 weeks ago. Our work continues to provide for the ongoing effort to get vaccine into our unvaccinated population, even as we scale up now for what we understand the major announcement last week being that third doses for all individuals having received Pfizer and Moderna 8 months after their second dose, effective in late September, portends that we will soon be moving back toward a larger scale vaccination effort, perhaps even in some respects looking like what we put forward in the spring for the initial phase of the vaccination campaign. And that, Chair Bernie, is my update for the boards, and I defer to Dr. Warren and Dr. Ludke.
Dr. Warren, Dr. Ludke.
Dr. Pat, would you like to present the current situation that we're seeing now?
Yeah, I'm happy to make a few comments. What I will say is really the good news, bad news dichotomy. I would say on the side of good news, it's abundantly clear after 18 months of this pandemic that we do have tools in our toolbox that can make a difference. In that regard, we really do control our destiny, should we choose to act on those tools and use them appropriately. We have seen time and time again across cities, states, counties, and even various countries that what we in public health call the NPI, the non-pharmaceutical interventions of social distancing, physical distancing, wearing masks, frequent hand hygiene, really can make a difference in slowing down the wave of this pandemic. And having seen that in one place is a little bit reassuring, but having seen it in multiple different cultures, different countries, we can make a difference, and we know that we can make a difference in this pandemic, hence our nudge to continue this work. Also, I think it's important to note we now have a vaccine that is remarkably, together, they are remarkably effective at preventing serious illness. They are far from perfect. There is no such thing as a perfect vaccine. We certainly wish we had one, but we do not. But they work very, very well at preventing severe disease and therefore preventing the overwhelming pressures into hospitals. And I will perhaps remind the commissioners that we have halted, a couple of our hospitals have halted elective procedures for the next 3 weeks. And anyone who has had a so-called need for an elective procedure knows that elective is in the eye of the beholder. Some people have severe back pain, some people have unstable angina, and they may not be as severe as others, and they certainly want to get that definitive surgery done to fix things. And yet they can't do that now because our hospitals have too many COVID cases. We have the opportunity as a community to make a difference with these non-pharmaceutical interventions, and also to uptake vaccine to decrease risk and decrease the pipeline into the hospitals. Switching to the bad news, and I did toy, should I finish with good news or bad news? But for Chair Bernie, I think I'll just finish with bad news. So
I don't get that at all. Go ahead.
Sorry, sir. The bad news is that we really, when we look at what in calculus we call the area under the curve, we integrate, sorry, but I can't look at those curves that Steve presented without getting a sense of calculus. You saw the winter surge. It was this lower level, broad-based surge that went on for, if you remember, we had 11 weeks where every 13 days we got 1,000 new cases. That's what happened for 11 weeks. If you take the sum total of the number of persons who became infected at that time, it typically is larger than these really sharp peaks, like we see a disease outbreak from a picnic that had tainted potato salad. You get a huge number of cases of salmonella over the course of a couple of days and it goes away. Delta variant has kind of looked like that picnic outbreak at first, really sharp peak, not a slow rolling, foothills of the Cascades kind of peak. So the challenge we see now is how soon before it comes down. And that is really dependent upon what we do with these non-pharmaceutical interventions, these recommendations for businesses and persons to comply. We can make that peak really sharp and come down fast if we choose to, or we could have a really high peak that ends up being significantly larger in terms of people affected than that 11-week winter period. So it's up to us as a community, and I think that's the role of the Board of Health, to nudge our community into that space of health. I'm going to pitch it to Jocelyn now. Thank you.
Thanks, Dr. Lucky. Yes, I don't think any of us thought we would be back here in 2 weeks reporting 3,260 additional cases. So that is really why we have felt the need to return after already providing an advisory a few weeks ago that clearly has not had the impact that we had hoped. Some other things have been observed as well. And because we're a local agency, we sometimes need to encourage action that is not necessarily based on the latest published research. We can't necessarily wait until that is fully vetted or published or finalized for release. Some of the things that we are seeing in Oregon and then also in some other parts of the country is transmission in outdoor settings. We know that the Delta variant is much more transmissible. In the past, we have said and continue to say that dilution is the solution. However, if you are shoulder to shoulder with people outdoors who are in your airspace, this Delta variant does appear to put you at much greater risk for transmission than the Alpha variant or earlier COVID-19 variants. So that's something that we really need people to understand, that large outdoor gatherings still present a significant risk. So that is included in our emergency advisory. And if you have more questions about the current state, we'd be happy to answer those, or we could walk through the advisory if that would be acceptable to you, Chair Bernie.
Thank you very much, Dr. Warren. The way our agenda is organized, we're first going to ask questions as it relates to what you've presented us, and then the next item is to actually take up and vote on the advisory you're proposing to the board. So with that, if that meets with your approval. With that, commissioners, are there any questions for the doctors, for Mr. Adams, or comments? Yes, Commissioner Buck.
Thank you, Chair. The first question I have is regarding the National Guard. I had a call from Peace Health, and they had mentioned that they've deployed National Guard down to Southern Oregon, and there will be a second launch of National Guard to our region here shortly, this week, it seems. I asked, what are they going to be doing? And is it their medical team? And part of the response was, well, it's known that our National Guard have a low vaccination rate. And so they're generally going to be doing things that are not, interactive with the community. So I then, it prompts the question, well, what do we need them to do versus what are they capable of doing? It seems like we're short of doctors and nurses, but this is not necessarily the team that we're going to be getting. So why are we not getting the medical team? And are the uses of the National Guard going to be substantially helpful, or is it really just behind the scenes stuff? I want to know that if they're coming into our community, A, I wish they had a higher vaccine rate, but B, that they're really going to be able to help the efforts here locally.
Chair Bernie, so Commissioner Buck, we have been advised that Oregon National Guard is coming in to provide support. So as part of the most recent surge with respect to hospital capacity, the state has set up an incident management team around hospital capacity in particular, and is essentially working directly with hospitals to try to assess needs and to match resources. So as you pointed out, the initial tranche of support went to Roseburg, to southwestern Oregon, down in the Medford area, and then over to Bend. I understand that many of the tasks, these aren't necessarily medical personnel that are available. And many of the tasks are going to be more support in nature. I am not specifically aware of vaccination rates. I have not heard that concern noted by our hospitals. I would point out too that the governor, I think, just given the nature of our National Guard, given the way that it's structured, a lot of the individuals who are medical are still doing their day job, and thus maybe not available to deploy through ONG. I know that our local hospitals are looking hard at traveling nurses. We've had conversations about how do we help house some of those individuals as they come into the community, and the governor has made specific requests for nurse strike teams through FEMA that could be surged into our area as well. The number of assets available are pretty small. There's other parts of the country obviously competing with us for those scarce medical personnel. But I'm told even some of the kind of non-skilled support activities does help to free up more caregiving time for some of the staff that are here.
Thank you, Commissioner Buck. Does that, okay. Any other commissioners? Yes, Vice Chair Farr.
Thanks, Chair Bernie, and thank you, Steve and Drs. Warren and Ludke for the presentation this morning. Helps solidify what I believe and what I will articulate as frequently as I possibly can. Each of us has decisions to make as to how we act based upon either personal observation, personal interaction, or reports from people we trust. I choose to trust you. The reports that you give, I trust, and I will report those reports as the truth. Other people don't trust your reports, they trust other people's reports. And each of us has emails, personal contact from people who do not want to believe the things that you're saying. They want to believe that there are lies, there's misinformation, there's a deception going on, and that many of the reports are fake or false. These are terms that people actually use. So I want to be able to really articulate to people why they should be vaccinated, why they should insist that their families are vaccinated, and why, Dr. Loki, we use the tools that we do know work. We know from observation locally throughout the United States and in other countries that the tools that we have work. Now, this is my question. Can I state to people, and this is based on ratios that I've seen, that if you or your family does not get vaccinated, they stand a 6 times greater chance of being hospitalized due to COVID-19. I get that number based upon the 85% figure that we had were given a couple of weeks ago, and I presume that that number is remains similar. That 85% of the people who are hospitalized are not vaccinated. Can I say that? Can I say you stand a 6, based on numbers, you stand a 6 times greater chance of going into the hospital based on COVID?
Chair Bernie, Vice Chair Farr, I'm happy to start with that. What I would say is a general increased risk from being unvaccinated for severe disease is absolutely clear. However, the clinical history of every person is different. Some people are very, very young and very, very healthy and have no immunocompromise. They have no cardiopulmonary disease. Their risk is quite low. Other people are older. We know that once you get above age 65, you're in a higher risk group. And as that age increases, that risk increases significantly. So if you were to pull all groups together, you might say a 5 to 10 time risk of severe disease for being unvaccinated. But if you were an 85-year-old person who had ongoing treatment for a cancer and was on chemotherapy, your risk might be 20 times or more. So it's hard to give just one number, which I understand, I think, to the general public, especially the lay public that might not be medically trained. That's a very frustrating inability to apply something directly to your specific experience. But we do know that the unvaccinated face a significantly higher risk of getting severe disease. And the clinical history of that person is also important and additive.
Chair Bernie, if I may, and Commissioner Farr, I would like also Dr. Lutke to speak to the role of diet and exercise in prevention as a prevention method. I think that is something that we heard in the comments this morning and something that I do see frequently. Could you address that, Dr. Lutke?
I do hear that as well, and I'm happy to do so, Chair Bernie and commissioners. So the immune system is a very complicated system, and it is required to act on all foreign invaders, whether it's a sliver in your foot or it's a virus in your lungs. And in order to do that, the entire system, all the players in that system have to be functioning well. So there are ways to so-called boost your immune system that are general ways of keeping the component parts of your immune system healthy. We don't have good data that mega doses of vitamin D or mega doses of an herb or a supplement will make a difference. But we do know that people who do not deal with stress very well, they do not have stress reduction strategies, have more frequent colds each year. We do know that people who do not have good sleeping hygiene, they have challenges. We do know that people who overuse alcohol, they have increased risk of a variety of infections. So it is important for those things that mom or grandma or your father told you, that includes good sleep and good nutrition, that they can help your immune system overall. I wish we had a silver bullet that would say, everybody for this virus take 2,000 milligrams of vitamin C, and that will decrease your risk by 90%. We do not have data of that sort, nor do we expect it to be effective based upon past studies in viruses and hyperdoses of of herbs or supplements. So Dr. Warren, I hope that was helpful. It's a little bit squishy because it is a challenge to apply it to a virus that's brand new. But it is important for us to sleep well, eat well, manage our stress. That can overall help our immune system.
Chair Bernie and Drs. Lutke and Warren, thank you again for that. I don't have time to say all those things to people. What I do have time to say is, if you don't get vaccinated and your family doesn't get vaccinated, they have a much greater risk of greater severity of impact by the disease, or a greater risk of hospitalization. I can't say, well, you know, we don't know about vitamin C, we don't know about vitamin D. What I can say is, if you do not get vaccinated, you stand a much greater chance of getting sick or going to hospital. And that's, unless I somebody tells me not to say that, that's what I'm going to go out of here saying. And I'll fill in some of the other blanks if people give me time, but most people aren't going to give me time to fill in the blanks. They're going to come back with, no, that's all a fake, that's all a lie. Well, I'll show them the graphs and I'll say, are you telling me these hospital numbers are a lie? No, they're not. I trust the people who are giving those numbers. And I'm not even going to ask this next question. I might ask, are you lying to me? I know you're not lying to me. I know you're telling the truth. So that's all I have, Chair Bernie. Thank you.
Thank you very much, Commissioner. Yes, Commissioner Trieger.
Thank you, Chair. I jotted a few notes last night and this morning, and I'm attempting to group them in a way so they follow our agenda, and I appreciate that structure that you provided, Chair. So some of these are comments about what we can do, which are more responsive to the order or the advisory that we're about to discuss. But for now, I have two sort of overarching comments I want to make, and then a couple of very specific questions. First, I want to say, and this somewhat tags back to some of the comments we've received through email and public comment, there's a difference between, quote, forcing people to take a vaccine and making certain events, activities, and privileges conditional on taking vaccine. So no one that I have ever heard in this organization or at the state health authority or at any governmental level is talking about a forced vaccination program. All manner of things that we engage in are conditional. You have to be a certain height to ride carnival rides. You have to have a driver's license and insurance to operate a motor vehicle. Some jobs require drug testing. This communal life that we engage in is conditional. And in some instances, vaccination is the condition. This is not new or unique to COVID. There are professions that have required inoculation or travel that requires inoculation. So I just want to make really clear that as we're talking about whether it's advisories or mandate, no one is talking about forcing anyone to take a vaccine, but certain activities and privileges may be conditioned upon a person being vaccinated. And that's okay with me. That's good public health practice and policy. I also want to say, Dr. Ludke mentioned, we have decades of public health research. We also have a mandate as a board of health. There are statutes that require us to take this function seriously as the board of health. And that's what we're doing. That's why I asked that we receive these updates as the board of health. And I'm really appreciative that it has brought us more resource, more information, more brains and research and experience to the table in having Drs. Warren and Ludke join Mr. Adams for these updates and presentations. It's really helpful and important and rounds out the information we need to do our mandated job as the county's public health authority, the local public health authority. And this is a global pandemic. I think we are, our scope is pretty limited in fixing a global pandemic, but there are lots of short-term mitigations we can do for the impact on our local community. And again, that is our statutory obligation. So I'm happy to talk more about those when we get to the order. My very specific questions in response to the presentation from Mr. Adams. When we talk about hospital capacity and ICU beds, I'm seeing a lot of conversation on social media and in the news generally about pediatric cases on the rise, right? Largely because that's an unvaccinated population as a demographic. Are pediatric ICU beds or pediatric hospital beds separate and counted separately, or are they inclusive of the numbers that we're seeing?
So, Chair Bernie, Commissioner Trieger, we are seeing statewide data on pediatric ICU beds, which indicate that we're seeing pressure statewide. I do not have data to present for our local hospitals on that. And that what we're seeing statewide in Oregon is congruent with what we're seeing elsewhere in the United States right now, which is certainly an increase in both adolescent hospitalizations and ICU admits.
So if I'm understanding, when you talk about bed capacity, it's inclusive across an age spectrum. It's not. Thank you. My other question regarding hospitalization use is, we're receiving transports from our region, our health district or region, whatever Region 3 is, as I understand it, Lane, Douglas, Coos, and Curry counties. Are we seeing
folks from outside our region coming to Lane County hospitals because of strain on capacity in other regions, or are we still just serving our Region 3?
Chair Bernie, Commissioner Trigger, we're serving Region 3 and Region 5, which is Jackson and Josephine as well. So we're seeing transports. We sometimes receive transports even from Northern California, Wairika, and those parts.
Thank you. And then my last for this round in this section of the agenda is several of us have received, and I've had people reach out to me, concerns both in favor and in opposition to the governor's actions around K-12 schools and vaccination for staff, masking, and so on. And as I explained to folks, that is really out of our authority to make any kind of mandates. But of course, any guidance that we may have for protecting Lane County residents who are under the age of 12, whether in school or not, is appreciated. And I don't know if that's something when we get to the order, if we want to talk about how the elements of this advisory do or do not specifically address the health and safety of kiddos under age 12, since there is no vaccine option for them.
Chair Bernie, Commissioner Trigger, I think all of the measures that are outlined within the proposed order speak immediately to protecting our kids. As you note, and as Dr. Warren described as a Swiss cheese strategy 2 weeks ago, these are the non-pharmaceutical interventions that we can put forward as a community to essentially create the conditions where our kids can go back to school across Lane County within just the coming few weeks. Getting the case curve down, intervening now is essential to ensuring that we have a more normal school season ahead of us.
Great, thank you.
Oh, yes, Commissioner Buck.
Another question that adds to the last one is, has there been any additional information on vaccinations for children under 12? I know a lot of people are trying to decide whether they put their kids back in school and are afraid to put them back while we're in the middle of a surge. And there isn't really an option to go back and forth, like wait till they get a vaccination and then put them back into school. Schools really need to have some stability and know who's coming and going. And so I know people that are just saying, well, I'm going to put them online and I'm going to hope for the best that they can go back to school once they get their vaccine. Everybody's waiting with bated breath for their children. So I'm curious if there's any additional information as to when that might come out.
Chair Bernie. Oh, please, Dr. Ludke.
Oh, thank you, Steve. So Chair Bernie, Commissioner Buck, I'm happy to start with that. Steve and I can probably tandem it. So the tea leaves, as we understand them currently, with data from the FDA, Pfizer will likely submit for their vaccine for age 5 and above in late September. And if the past is predictive of the future, the FDA will take a couple weeks to review all of that data. It's a large data package, as you might imagine, significantly larger than the adult package. Kids have a different immune system. More data is required to be reviewed. And also, instead of a 2-month review that was required for adults, it's going to be a 4 to 6 month for kids. So that's why it's taking longer. So I suspect within a few weeks, the FDA will review that package, and maybe we'll have a Pfizer vaccine on the market for age 5 and above sometime in October. Moderna is roughly a month behind. They have not telegraphed their plans as much as Pfizer has. We are expecting Moderna to be a month or so behind, but we don't know. They haven't gone public with their info. We've heard very little in the pediatric space for Johnson & Johnson or for Novavax. We think Novavax will have their vaccine by the end of this year for adults. We're crossing our fingers on that. Moderna will go down to 6 months of age and above, so the toddlers and infants. And again, probably not till November, best timeline for the Moderna vaccine. Unfortunately, school will have already started. We will not have the full benefit of vaccines for these pediatric groups until later.
So my questions or comments, my understanding is that one of the key reasons we look at hospital and ICU bed data relates to the ability of our healthcare system even to address patients in need, people in need. So with that as a backdrop, let me share what the CEO of McKinsey Willamette shared with me 2 weeks ago when this board adopted the advisory that was proposed, that was recommended. Our challenges have really been around staffing, not enough nurses, techs, housekeepers, etc., coupled with staff preferring to stay home for those unemployment checks. And skilled nursing facilities are full. So we have 5 to 7 patients a day in hospital beds who are ready to discharge and transfer to an SNF, but they're still here when admitted patients in our emergency department desperately need those beds. That was 2 weeks ago. So my question is, how has that situation changed? How many ICU beds what is our capacity looking like? Things of that nature.
So Chair Bernie, in answer to your question, McKinsey Willamette is reporting that they have 1 bed available this morning in their hospital. So capacity constraints continue, both at McKinsey Willamette as well as at Peace Health. We understand that they are bringing in some additional traveling nurses, as I indicated earlier, which increases their staffing level. But the relative rate of staffing up is, my sense is that we're not likely to stay ahead of the numbers of folks currently needing to get into hospital.
Thank you. And Doctors Warren and Leckie, I remember one of you mentioned, I believe that now people with elective surgeries are asked not to do those for the next few weeks. Have you ever seen this in Lane County before? Even that kind of a capacity issue?
Chair Bernie, I've been here for 10 years. I have not seen that. We have had one time in that 10-year period. I believe it was the influenza season of 2017, 2018, which was a particularly nasty season, where a fair number of elderly persons in long-term care facilities got influenza in large outbreaks, and they needed hospitalization. And some of our smaller hospitals, Peace Harbor on the coast in Florence, Cottage Grove, were significantly hurt. You know, when you only have a 20-bed hospital and 30 people show up who are in their 90s with respiratory illness, that's a problem. But we worked very closely with those long-term care facilities to ensure that they would accept patients back as soon as they were stable and then decompress that hospital, if you will. But it was short-lived. This is the proverbial rat going through the snake belly. It's a big bulge. It's a challenge.
Thank you. And Dr. Warren, did you want to say anything or no?
I would just add that the stress and strain on those hospital staff too is also enormous. It is one thing to deal with a sudden surge, as we saw with the influenza outbreak in the winter of 2017, but this is wholly different. And to keep up this response day after day is really taxing the system.
I can't even fathom it, honestly. I mean, you know, I've probably spoken too much, but my youngest had a child at Riverbend about 5 or 6 days ago, and just the COVID protocols were such that parents, grandparents, none of us could come in. And since this was a 3-day visit because of the difficulty of the labor, it just dominoes down in terms of its effects. Dr. Warren, you made a statement that I'm probably wrong. I expect you to put me in my place, but I would challenge it a bit. You said that the advisory that you requested this body 2 weeks ago adopt, which we did unanimously, did not have the impact that you wanted. And my sense is that advisory really was superseded 2 days later with an indoor masking mandate from the governor. And even with that, this virus seems to be so aggressive and so highly contagious and so potent a variant that it seems to have changed everything. So would you say that, you see where I'm going with this? So would you say that the advisory didn't have the impact, or really the situation has fundamentally changed?
Well, I'd say there is a lot we don't know about this variant. So the measures that we have proposed previously, we've had an infectious period in 14 days, and we haven't seen a decline with that indoor masking. Indoor masking is going to be the very least of which is needed. I think we can all agree on that now. And it's going to require more than that, I think. Thank you, Chair.
No, thank you so much. And I didn't mean for that to be, I mean, we're all trying to get our arms around this as best we can. Of the people in ICU beds, what % of them are unvaccinated?
Chair Bernie, I do not have that data point in front of me.
Chair Bernie, what we can share, through July, the COVID deaths have been roughly 90% in the unvaccinated, and hospitalizations were right around 88% in the unvaccinated. Perhaps Steve and this team can pull up the last couple weeks, but it's around the 90% of COVID deaths and hospitalizations. ICU, I don't know that we go down to that granular level, but perhaps we can dig that up for you.
So thank you very much. And this, to me anyway, that data reinforces the point I think Vice Chair Farr was trying to make, which is that if I live in one of those area codes or zip codes that is least vaccinated, 97478. So I am getting a tremendous number of inquiries, and I have to make it as simple as possible. So that data at least is helpful for me to make it as simple as possible for those few people that ask me what I would recommend.
Chair Bernie, if I may, one statement that I think is epidemiologically accurate and relatively easy, I think, for many to understand is the masking and physical distancing manage the pandemic. Vaccine is how the pandemic ends. And I think it's absolutely epidemiologically accurate. That is how this ends. So that might be helpful.
That's, for me at least, that's exceedingly helpful. In fact, I'm going to call you up and write it down when we have a chance. Are there any other commissioners with any other comments, questions? Yes, Commissioner Farr.
Thank you, Chair. I did write that down, by the way. I'll text it to you.
That good. I won't impose it on Dr. Lemke.
But those are the kinds of words that are really helpful, because no matter what data we produce, there will be people who do not believe that vaccines will do anything, and they believe that it's a conspiracy, that it's some kind of way to control people. And we just have to use all of the information we possibly can to convince them otherwise. Ms. Gaffney, I have a question for you that maybe this is more directed toward you. During the COVID initial phases, we operated 100 River Avenue as a respite, in particular for people who were unhoused. Are we in any way able to use 100 River Avenue to help hospitals ease the crunch on their beds at this point in time? If the answer is no, I understand, but it's just a question out loud, because I know we're quickly moving along to the next phase of 100 River Avenue.
Thank you, Chair Bernie and Commissioner Farr. And Steve Adams, please feel free to come in behind me if you have additional information to add. As you know, we have started the transition of that particular building to its next best use as a navigation center for people in our community who are homeless. So that work is proceeding with a scheduled opening date no later than July of 2022. And in order to meet that timeline, we needed to move that forward. So as that transition happened, Steve and his team were able to secure rooms in a hotel in our community. And in a lot of ways, the hotel setting allows us to be able to isolate people in their own rooms. We are in the process of working with community partners to identify appropriate support service levels. Some people are clearly able to manage by themselves in a hotel room in the same way that if I was discharged from the hospital, I would be able to manage at home. Other individuals need higher level of supports to be successful in that environment. And so I think that's been the challenge as we calibrate to just that huge spike you saw on the earlier slides as the numbers of people are so high and the variety of needs. So Steve, I don't know what you might add to that answer.
Chair Bernie and Vice Chair Farr, I think, Karen, that is precisely where we are. And just as an indicator of demand, we've been averaging about 45 families under current support in terms of isolation and quarantine assistance. We have been seeing about 5 or 6 individuals in that hotel facility at a time over the last week to 10 days, I would say. But of course, the assistance that we provide beyond those who need the hotel facility includes those who need groceries and other assistance in order to successfully isolate or quarantine within their own home.
Yes, Commissioner Trieger.
Thank you, Chair. I'm aware of the time, but I think this topic is just so important. And I know we still have yet to get to the advisory, and that'll probably prompt some conversation. I know I have some questions and comments about it, but I did want to just add that while there is a shortage of medical professionals, it takes many more people to staff hospitals and medical facilities. And particularly, Chair, when you read that message from, I believe it was someone, an executive at McKinsey Willamette, about workers choosing or preferring to stay home for unemployment, I really just want to caution us against feeding that narrative. It takes people to do the laundry. It takes people to provide the food service in the hospital. It takes people to administer the checking in and checking out of patients and so on. It takes hundreds and hundreds and hundreds of people in a workforce, not just the medical professionals and the highly trained medical professionals. And all of these folks are putting themselves in harm's way by staffing these kinds of facilities. And so people who are choosing to stay home are doing so to protect their own health and safety, their mental health and safety, and their family members. Many of them likely have children at home where there is no safe and available childcare for them to go, or they don't want to potentially expose themselves to the virus and bring it home to unvaccinated children who are too young to be eligible for vaccines. So I just think it's really important that we remember the workforce challenges are not just about the medical professionals, although those are critically important and much needed. So I really appreciate the creative thinking about 100 River Avenue and this idea of hotels, but more beds have to come with the staffing and the workforce to go with it. And the other thing I want to say is there's been a lot of chatter on social media and some of the emails I receive in addressing the hospital capacity and the strain on the medical system. And there's a lot of resentment building around folks who have taken the vaccine to folks who haven't, and saying, you know, we shouldn't be treating people who didn't take the vaccine. And I just want to publicly state, I don't think that's a useful framework to have these conversations in, to demonize people who, for whatever reason, there's a spectrum of why some people haven't taken the vaccines, a very small percentage who actually truly have medical contraindications, all the way to folks who, as Commissioner Farr has been talking about, are really just completely disbelieving of the veracity of the reams and reams of public health data around this pandemic. And it's not what medical professionals do. They triage people according to medical need. Just like if 2 people come in who were on a motorcycle that crashed, one of whom had a helmet on and the other who didn't, they don't triage who to treat based on which one chose to wear a helmet and which one didn't. They do it based on medical necessity. So I just want to be really clear that we're not here to demonize people who haven't taken the vaccine. We're here to encourage everyone and provide good, sound information about the safety and efficacy of the vaccine.
Thank you. I have a question. If I was having a statewide conference planned for Lane County in mid-September, by the way, this is the case for more than one group, that was planning to have delegations from across the state come, and was really hoping to have this be in person, but things are changing. What would your advice be?
Chair Bernie, I can.
Dr. Warren.
I'll start and then I'll kick it to Dr. Patrick. Dr. Ludke and I are in a very similar position. We have our annual meeting of the Coalition of Local Health Officials in mid-September as well. And our group also has elected to go virtual and to delay the in-person meeting, which is very important for lots of reasons to have an in-person meeting. I think we all recognize that, but that a delay is really important at this time, we felt. So if you'd like to use our experience, you may.
Well, I really appreciate that, because literally 2 groups that I'm aware of and interfacing with have asked that, and I'm taking advantage of your presence to give them better information than I could. Dr. Ludke, were you going to add to that or no?
Chair Bernie, I would not add to it. Dr. Warren was more eloquent than I could hope to be.
Are there additional comments or questions before we move on to the requested board order? Seeing none, we now are on item 3A, which is emergency business, which is order 21-08-24-08, that our public health professionals are requesting this body approve, and that is in the matter of calling for all individuals, businesses, public venues, and employers to take additional immediate actions against the Delta variant SARS-CoV-2 and COVID-19. I have here Mr. Mokrahysky, Mr. Adams, Dr. Warren, Dr. Ludke, whomever would like to begin a discussion of this item.
Chair Bernie, I think I will take this one. Thank you.
Please.
So I refer you to the draft resolution and order that you have before you. I believe that we have spent the earlier part of our discussion just talking about the whereases and the current conditions in Lane County in the last 2 weeks since we last met to talk about COVID-19 recommendations. So I will move on to the therefores and talk a little bit about what immediate actions we recommend that people take in terms of both individuals, businesses, and venue owners, operators, and permitting authorities. So to begin with individuals, regardless of vaccination status, so I think that is very important. People should be wearing masks indoors when they are not with their members of their immediate household. They should also be wearing masks outdoors. So this is something that we are putting forward, knowing that there is not great information and evidence about the transmissibility in outdoor situations yet, but we have enough anecdotal information, both in Oregon, Washington State, and other places to note that this is a possibility, especially in other venues. And we'll talk a little bit about that a little bit more when we get to the venues themselves. We also want people to remember the other non-pharmaceutical interventions, or NPIs as we call them, as Dr. Ludke mentioned earlier, and that's continue to carry hand sanitizer and wash your hands when possible. It's very important that people avoid crowds at this time. Anybody that is within your airspace could potentially pass the virus. We also ask that people avoid unnecessary business and leisure travel, and that you also, because of our hospital capacity is so limited, that limit activities that could lead to injuries requiring hospital care. So just taking extra care in these next few weeks while we are really cognizant of what's happening in our hospitals and how little capacity they have. We also ask that if you are unvaccinated, please consider staying home and avoiding public interactions as much as you can for the next 2 weeks to give ourselves a chance to reduce the cases that we're seeing in the community. and also to get vaccinated as soon as possible for those who haven't. Vaccination, as Dr. Ludke mentioned, is the way we end the pandemic. There are other things that we can do and that we have been doing for a long time to manage the harms of COVID, but we can end this with vaccination. And so it is certainly our great wish that people will opt to do that. In terms of businesses, we ask that people ensure indoor masking that is consistent with the latest governor's announcement. We also ask that outdoor masking for those 5 years of age or older, and also 2 years of age if they can tolerate it. We understand that that is not available to all toddlers for sure, but this is also regardless of your vaccination status, that you need to be able to maintain that 6 feet of distance. And if you can't, even outdoors, please mask. Also limit capacity to facilitate social distancing. That's important in terms of these places where you really need to be able to spread out to maintain that 6 feet of distance, especially indoors. Make sure that signage reflects the masking, and that you also have staff that are helping to remind people. It's been hard, I think, for sure, on businesses. We understand this. It's been kind of, it looked like things were relaxing and then people were going back to a lot of what they were doing, but we really do need to stay the course, and any little bit that we can all do to encourage each other to attend to these practices, I think will benefit all of us. And then finally, for public venue owners, operators, and permitting authorities, and we acknowledge that there is limited evidence of this, but we have seen transmission associated with the Lane County Fair. We've also noted that there was a music festival in Pendleton, the Whiskey Music Festival, in which there were 62 cases associated with attendance to the music festival. That transmission appeared to be primarily in the front of the stage, where there are people mixing very close together. These folks were unmasked. So that we are acknowledging that there is outdoor transmissioning happening in some of these settings, and it's important to remember that this is part of aerosol science, right? It's not just a matter of being indoors or outdoors. It's where you are vulnerable to other people's airspaces. So we strongly recommend postponing large events, especially when it's difficult to space people in those events until the transmission is reduced. If it's not possible to postpone those events, please require masking both indoors and outdoors, regardless of vaccination status. Consider requiring proof of vaccination or a negative laboratory test for entry. We saw that this was effective or appeared to be effective at Lollapalooza in Chicago, where they had, I believe, an 88% vaccination rate, and there appeared to be very low transmission within that setting. That is still anecdotal and preliminary information, but it appears to have been somewhat successful. Of course, please provide ample sanitation stations for hand washing in those facilities, and consider the places where people are most likely to congregate, which would be the entrances and exits and potentially front of stages and those areas, so that people can also think about being able to maintain distance. Consider touchless vending options if possible. And then again, posting signage that is appropriate so that people are reminded consistently of the best practices during this time. And then finally, for employers, following the public health measures that we have already outlined, consider instituting vaccination and/or testing policies for workplaces, especially with this full FDA approval. Encourage remote work for employees where possible. Ensure that workplaces can facilitate distancing, as we mentioned. Limit unnecessary travel for employees. Some people were beginning to consider traveling again, and we encourage people to reconsider that for the time being. And encourage and provide the supports needed for your employees to get vaccinated, including potentially paid leave for recovery and other things they may need in order to take care of themselves and their families. And Chair Bernie, that is our recommendation.
Thank you very much, Dr. Have discussion before a motion. I don't see anyone jumping up and down about either of those. So who would like to speak, or Vice Chair, would you perhaps like to make a motion? Vice Chair Clark?
Chair Bernie, I will make the motion, and we can have discussion toward the motion. Chair, I move order 2108-2408 in the matter of calling for all individuals, businesses, public venues, and employees to take additional immediate actions against the Delta variant, SARS-CoV-2, and COVID-19.
Thank you very much. Thank you very much, both of you. Thank you, Vice Chair Farr. Thank you, Commissioner Trieger. Order 21-08-24-08 has been moved by Commissioner Farr, seconded by Commissioner Trieger. Now let's have discussion towards the motion, and thank you very much, Drs. Warren and Ludke, for being here for this. Yes, Commissioner Farr.
Thank you, Chair Bernie. And this is a question maybe directly to Mr. Mokrahajski, and it's regarding Lane County employees. We do know that many Lane County employees have the ability to work remote. And I have been asked to ask this question. I believe Commissioner Trieger also received this same request by one of our stewards, which is Officer Linda Hamilton. Are we, as a county, encouraging people, if they can, during this period of time to work remotely?
Thank you, Chair and Commissioner Farr. You're correct that I would say anywhere between a third, probably about half of our workforce at one point or another has worked remote over the past 18, 19, 20 months. Important to remember, we have a large portion of our workforce that their jobs simply cannot be completed remotely. So many healthcare workers, most public safety workers, road workers, park workers, those that are in the field doing their works on the front lines. It's not possible for them to accomplish that remotely. So I would say, again, approximately half of our workforce, give or take, during some, not full time, all of them, but at least a portion of their work was done remotely. We are encouraging that where possible. Certainly I've used the example oftentimes of land management, our customer service center, where we know that those employees working remotely were not able to deliver the level of service that our customers demanded, or that those employees wanted to be able to provide to the public. So what we're really trying to do is balance where it's possible for employees to work remotely and do their work as well or better remotely than they were able to do in person. Then we're certainly encouraging that. And so that we've extended the temporary administrative procedure manual that's allowed for remote work through the end of this calendar year. And we continue to identify where it's both possible and feasible for our employees to do so.
Chair Bernie, Ms. Mokrahajski, thank you. That gives me my answer very clearly. That seems like a strong recommendation that if you can work remotely, go ahead and do that. Thank you, Ms. Mokrahajski.
Thank you, Commissioner, and Commissioner Trieger.
Thank you, Chair. As I mentioned earlier, I have a few things, but to immediately follow up on that, and thanks for bringing that up, Vice Chair. Mr. Mokrahajski, can you tell me who makes the determination if an employee feels they can adequately perform the duties of their job and deliver the service that's expected of them? Do they make that determination? How is that made, and how are we applying that consistently and equitably across the organization?
Thank you, Chair and Commissioner Trieger. It's a combination of certainly employees have the ability to advocate and request to be able to work remotely, and then their supervisors, the managers of divisions, and ultimately department heads approve that remote work in conjunction with in determining whether or not that work can be done remotely, and whether or not it was effectively done during the time that we had many employees working remotely. So it's a combination of the requests from employees along with supervisors, managers, and department heads determining what work needs and service needs are for the organization.
Thank you. My other questions, I'm wrestling with whether to even ask them in this order or first to ask this more broad question about, I think I'll ask the broad question first because it may prompt a sort of a different tone of our discussion. When we passed the advisory 2 weeks ago, of course, there are some people in our community who just don't think we should take action because they don't believe there is such a thing as a COVID-19 pandemic. I'm not speaking to that. I'm speaking to people who had to the difference of opinion about the efficacy of passing an advisory versus a mandate, and very much understand. I understand the difference, and I understand part of the reason that we're issuing advisories has to do some with our ability to sort of hold anyone accountable to complying or not. However, with the direness of this situation and the fact that we clearly have people who ignore an advisory, it makes me wonder if if the gap isn't greater between the people who might not take an advisory seriously but would comply with the mandate. If that gap isn't big enough and we aren't going to cover more people than the gap of people who will flout it just because they don't believe there's anything anyone's going to do about it. And the part B of that is, are there not in fact some things we could do about it? I understand we don't have the resource and the structure, the infrastructure of something like an OSHA, but we do have environmental health workers who are continually monitoring and have relationships, for example, with our restaurants and spas and so on. I just really want to understand. I need to feel better about us issuing an advisory versus a mandate at this point, given the information that we've been presented with this morning about the growth of cases in our community.
Please, Dr. Warren, if.
Okay, yes, I'd be happy to, Chair Bernie and Commissioner Trieger. Thank you. I think that it's a really good question. I struggle with that too. Public health has not historically been in the position of being an enforcer or having police powers at this level. There's been a robust conversation nationwide about whether that's important or something we need to do. I'm hesitant a bit about the environmental health specialists, knowing that they're quite busy and they have their hands full with ensuring that the businesses that they serve have the ability to open again. There's a backlog of inspections that have needed to be done. For example, in pools, where pools haven't been inspected for a year and a half, and it turns out that many of these pools really needed the inspection and the guidance from the environmental health specialist to be able to reopen safely. So there are aspects that they're doing that are really ensuring the safety of our community, and pulling them aside to do enforcement of a mandatory mandating masking would impinge their ability to do their other work. It's an additional body of work that we don't necessarily have the workforce for, or the training to do that. That said, I am not opposed in theory to a mandate. It's just that I do think the enforcement piece is a big hurdle that we are just currently not set up in order to be able to do. I also wonder, it seems, and I wonder about that gap too. I don't know what that gap is between people who immediately, when they hear mandate, then there are some people that are very willing to comply. There are also some people who are much less willing to listen if it's compulsory. And I am also hoping that we can appeal, as we do with other advisories in public health. Let's say, we tell people to stay out of the water when there's an algae bloom, but we're not patrolling the lakeside. We expect that people will take common sense measures to protect themselves when they're alerted to an emergency. And I know that that's not a great analogy, because this is obviously much more dire, and the implications for other people are different. So I think that it's transmissible, and that everybody who gets COVID gets it from somebody is the thing that is different about this one, so that people do have an additional responsibility. It's not only their health that we are talking about here. But I have the same struggle. I'm sorry, I don't have a good answer for you.
Yeah, thank you, Dr. Warren. I wasn't really anticipating. I mean, it's the challenge, right? And I just briefly, in reviewing the ORSs, I mean, we are given the authority to, for instance, to adopt civil penalties for noncompliance with public health orders. I know we do have the so-called police powers regarding isolation and quarantine, but I'm not sure. That's not what this order gets at. So I'm with you. And I just think, whether we get to it today or not, depending what happens in the next week, let's say we issue this advisory. I want us to be prepared, and I want us to have this conversation and to really understand what the tools are at our disposal so that we're making a conscious and informed choice as a Board of Health about how we're instituting these, whether they're advisories or mandates, or why not, or whether there are pieces of this that we could pull out and mandate, have an overarching advisory with some specificity of mandate. I'm not sure. One example of that, again, is, obviously we want to do everything that is within our control and jurisdiction. So if we can't mandate capacity limits for private venues, we can certainly do it for our own buildings. I was watching people queuing up for jury duty as I walked into the public service building this morning, and I'm not sure the line was particularly well spaced, for example. The Lane Event Center, we rent that out to private concerns, but it's our property. We could put limitations, we could put capacity caps on our indoor spaces. So I want us to really do that work of picking and choosing where it's clearer for us to be stronger than a simple recommendation or advisory. I want us to do that.
Thank you, Commissioner. Are there any other commissioners with any other comments or questions? Okay, hearing none, I'm going to call the question. All those in favor of Order 21-08-24-08, made by Vice Chair Farr, seconded by Commissioner Trieger, please signify by saying aye.
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 Opposed? Let the record show that Order 21-08-24-08, in the matter of calling for all individuals, businesses, public venues, and employers to take additional immediate actions against the Delta variant SARS-CoV-2 and COVID-19, has been unanimously approved 4-0. And while Commissioner Bozovich is absent, he did inform this body during public comments that he also supported this board order. Thank you very much, and thank you for your time, Mr. Adams, Dr. Ludke, Dr. Warren, and carry on. It's intense out there. Thank you very much for your work.
Thank you, Chair.
Thank you.
We are now on the consent calendar. Is there a motion? Thank you, Chair.
Adjourn the joint meeting first.
Oh, thank you, Steve, and thank you, Pat. Thank God there are people more on it than I am sometimes. This adjourns the joint meeting of the Lane County Board of Commissioners and the Board of Public Health, and we rejoin the August 24th, 2021 Board of Commissioners meeting, and we are on item 6, consent calendar. And again, thank you both. Yes, Vice Chair Farr.
First, Chair Bernie, I have less to keep track of than you do, so please, no things are necessary. But at this point, I would like to move the consent calendar for August 24th, 2021.
Thank you, Vice Chair. Is there a second?
I'll second.
Thank you, Commissioner Buck. Vice Chair Farr moved, Commissioner Buck seconded approval of the consent calendar for August 24th, 2021. Is there any discussion to the motion? Seeing none, I will call the question. All those in favor, please signify by saying aye.
Aye.
Opposed? Aye. Was that yeah, it had to be in favor. You made the motion. No, yeah, I guess that doesn't matter. Correct me if I'm wrong, but that was 4 votes in favor, 0 against. The consent calendar is approved unanimously. Commissioner Bozovich absent.
Chair Bernie, forgive my laughing, but the delay on my iPad caused you to sound just like a pirate when you said that. You said, that was my laugh.
Well, I'm glad you said it. I was going to, but no. Thank you, Vice Chair. We are now on item 7, Health and Human Services, Order 21-08-24-05, in the matter of adding 11 full-time regular positions among the following classified positions: Professional Technical Supervisor, Senior Community Health Analysts, Medical Assistant, Senior Stores Clerk, Community Service Workers, and Community Health Analysts in Health and Human Services Fund 286 within the Department of Health and Human Services. And Ms. Gaffney is here to explain this to us.
Good morning again, Chair Berney and Commissioners. I imagine that this does not require as much explanation on the heels of the conversation you've been having this morning with our staff in the Emergency Operations Center and Public Health. This order creates an additional set of positions that are critical for our response to COVID-19. As you know from the written materials, we've been staffing much of this effort with extra help and temporary employees, and we have all come to realize that this response is going to be with us much longer into the future, and it really benefits us to have employees who can stay with this effort once they've been trained and not need to turn those over as much. And we do also need to continue to look ahead to our public health modernization efforts. So the positions in front of you today allow us to be able to have regular status positions that will be doing this work for the next year or two as we move into the future. We do have a number of people, individuals who have been really performing outstanding work in those more temporary status, and I anticipate a number of them will be applicants for these positions as well. So I'm hoping that we'll be able to take advantage of training and skills that have been invested up to this point, and it also will enable us to quickly keep the work moving. So I think maybe I'll stop there. I'm happy to answer any questions the board might have.
Thank you, Ms. Gaffney. And I see Vice Chair Farr's hand up.
Thank you. Ms. Gaffney, I'm going to ask a question that I kind of gave you a heads up about during the agenda setting on this particular item. You know, when I was doing the hiring for Jerry's, sometimes I was hiring part-time seasonal help, and that was relatively easy to find people. Sometimes I was hiring a controller, and that was a little bit more difficult. You have a broad variety of jobs here, and just my general question is, with it being so difficult for private industry, nonprofits, and everybody else to find applicants today, how's your level of confidence that we're going to be able to fill these jobs in a relatively short order? And understanding that just passing the order doesn't fill the jobs, that just gives you the authority to do so, Ms. Gaffney.
Thank you, Chair Berney and Commissioner Farr. I appreciate that question, and absolutely, I think across our community and our state, we're all experiencing workforce challenges right now as we work to recruit for positions. And I think you're absolutely right that the answer depends a little bit on which of these positions we're talking about. Some of them will be more easily filled than others. I will tell you that in anticipation of your action today, we did request and receive permission from the County Administrator and Budget Office to go ahead and begin the recruitment so that we can be as efficient as possible. We know the need is urgent, and as I mentioned in my opening remarks, we know that a number of people have been helping on a temporary basis as part of our response, and we're hoping that that will improve the pool of applicants who meet the minimum qualifications for this work and you know are ready to and standing by to apply for these positions. Some of the positions will take a longer time to recruit, and we are working hard to expedite that as much as possible.
Chair Berney, thank you, Ms. Gaffney, and I fully support the your moving forward with bringing in people who have already been doing the job well on a part-time basis. So good luck, Godspeed, and get it done. Thank you, Ms. Gaffney.
Thank you.
Thank you, Vice Chair. Any other comments or questions? I have just a quick question, if I may, on protocol. So this body has not yet approved these positions, right?
That is correct.
Correct me if I'm wrong, but my understanding is you're not only hoping people apply, but you've already accepted applications and have in fact interviewed people. Is that not correct?
Yes, as I mentioned, Chair Burney, in response to Commissioner Farr's question, we did request and receive permission, as outlined in the Administrative Procedures Manual, to post these positions and begin the recruitment in anticipation of your action today. We, of course, have not made job offers or placed anyone into these positions until you take your action today to create the positions.
Mr. Mokrahajski, do you want to say something?
Just that the reason for that policy is to allow for us to move forward. It's sort of similar to what we do with grants, that sometimes if there's funding available, we'll go after that funding, and we'll come to the board later for, to actually accept and spend those funds. The same thing with positions. When we have critical positions that we want to create, we allow for, in certain circumstances, if there's a timing need, to move forward and post the position and begin the recruitment process, because it's a lengthy process. We want to make sure that we recruit and retain the best talent in the organization. So it's just a process that we've set up, but we would not make an offer or hire the person for this position or in those other cases until the board actually approves.
Oh, and I'm absolutely going to vote to approve personally, but just in terms of protocol, because I don't understand it. So these are positions that are already, in a sense, the work is being done by temporary people.
For many of these, Chair Burney, that is true, that we have been hiring people extra help or temporary as part of the response.
Right, but I was just going to but I mean, doesn't the county, I mean, this is just general, and thank you, I'm not going to beat a dead horse. Doesn't the county, when you recruit and interview, is that not at some risk if the board doesn't approve the positions? I'm just trying to understand. You see where I'm going with this? I mean, are we just rubber stamping something that you've already put in place, or aren't you taking a risk with people that want jobs if we don't approve the positions, given how far you've already? See what I'm trying to get at?
I do, Chair Burney, and thank you for the question. Yes, there certainly is a risk anytime we begin the recruitment prior to the board's action, that the board could ultimately decide not to create all of the positions or any of the positions. And so that is why we are clear with applicants that we're not making job offers or hiring anyone until that final action is taken by the board. So yes, there is a risk to that, and we weigh that against the risk and costs of needing to wait. And right. as the county administrator said, they're really, the recruitment process is lengthy, and for us to submit a packet to the commissioners for consideration, we need to do that several weeks in advance of your meeting. So that would add an additional several weeks to that recruitment process. So it is a balancing act for us in terms of those risks. And it is important to be able to get people, whether they're people who are working temporarily for us now and might be running out of hours that are allowed, or positions that are going completely undone at this point, to get those filled as quickly as possible after the board's action.
And thank you. And I'm sorry, I see Commissioner Tree. Just one more. I'm done. But are these permanent positions, or are these looking at? I know a lot of our COVID positions are only looking at 1 year or 2 years, or are these permanent? And is that part of why kind of wanting to get on with it?
Thank you, Chair Burney. We don't necessarily talk about permanent positions because things can always change. These are regular status positions, so they are fully benefited, ongoing positions. We do not have we don't have a limited duration position within our bargaining units right now that goes beyond a temporary, which it has a maximum of 1,040 hours in a year. So there isn't a position that would be just 1 year or 2 year at this point.
Well, thank you very much. I did notice Commissioner Trieger's hand was up.
Thank you, Chair. I think this is connected to what you're getting at, and it just prompted me to ask just to make sure I'm understanding. And also, I appreciate the analogy of grants. That made a lot of sense to me that Mr. Mokoheisky mentioned, that often you apply for a grant and you start recruiting as if you're going to get it. And then if you don't, you have to put a halt to the process, but it keeps you on pace to do the work that needs to be done when it needs doing. My question is, and maybe this helps get at some of your concerns, Chair, the confusion is, if we have people already working for the county in temporary positions who've applied for these, and then let's say this order doesn't get approved or isn't approved in full, is anyone at risk of losing a current temporary position because they've applied for a permanent one? In other words, are we replacing them because now they're in the pipeline for a position that may not come through? Or is that not a concern?
Thank you, Chair Burney and Commissioner Trieger. That is not a concern. At this point, we are needing additional people. So the only reason a temporary, someone who's currently working in a temporary or an extra help status would lose their job is if, besides performance problems, of course, is if they run up against that maximum hour limit. As I said, our extra help positions, individuals are not permitted to work in excess of 520 hours in a year, and temporary employees not in excess of 1,040 hours in a year. So if they hit that hour maximum, then yes, those individuals would need to be terminated.
Thank you.
Well, Ms. Gaffney, I don't think you expected us even to have this much conversation, but thank you. I was concerned just with protocols, and this was a good opportunity to get into it. And thank you, Commissioner Trieger and Commissioner Farr. Is there anyone else that would like to speak or speak again before we call this question? In that case, okay. In that case, all those in favor of Order 21-08-24-05, motion made by Vice Chair Farr and seconded by Commissioner Buck, please indicate by saying aye.
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 Well, Commissioner Farr, your voice delay did not stop you from voting for Commissioner Buck. Please let the record state that it was unanimous vote 4-0 approving Order 21-08-24-05 in the matter of adding 11 full-time regular positions with Commissioner Bozovich absent. Ms. Gaffney, thank you very much. It's been a long morning. Yeah. We are now on County Administration. Item A, Order 21-08-24-06 in the matter of adopting the fiscal year 21-22 through and to fiscal year 25-26 Lane County Capital Improvement Plan and delegating authority to the county administrator to execute contracts for road and bridge projects with terms less than 10 years. And my notes say Colin McCarthy and Peggy Kepler, and my eyes say Sean Waite. So Ms. Waite, oh, and Ms. Kepler, please.
Thank you, Chair Burney, commissioners. My name is Sean Waite, and I'm the Facilities and Capital Planning Manager for the county. I am filling in for Colin McCarthy, our Capital Improvement Supervisor. He was unable to attend the meeting today. I'll let Peggy take a moment to introduce herself.
Peggy Kepler, Lane County Engineer and Engineering and Construction Division Manager for Public Works. Good morning.
Good morning.
Diana, I need to share my screen and I'm not seeing it.
One moment.
Ta-da.
Can you see it?
Yes, we can. I was trying to give you a cue.
Thank you, because I can't see what you see. And my computer's thinking, there we go. Okay, thank you so much. And we'll go ahead and get started. So we are here today to share the fiscal year 22 through fiscal year 26 capital improvement plan. And this is the 4th annual 5-year CIP plan that we have done. So we're really excited that we are starting to develop this process and get it through a standard yearly approval process. We did present the preliminary draft back in February of 2021. There hasn't been real significant changes to the document, but we'll go ahead and go through the presentation. So the goals of the CIP are really to ensure that we're adequately maintaining our assets and to provide an inclusive planning process with policymakers such as you and community. And we also want to enable planning, prioritization, and decision-making. So projects are estimated to have a monetary threshold of 50,000 or more are considered capital projects. And we have 3 forms that we require either departments or public works or our county improvement section to complete in order to get into the CIP plan. Those forms are a standard form, which is when a project has been through the initial planning process, funding has been secured, and work is scheduled to start within the 5-year CIP process. We also have our pre-planning form, which is for projects that are under discussion, but there's been no formal planning process and funding hasn't necessarily been secured. We also have our community investments form, and those forms are submitted to identify projects that the county doesn't necessarily own, but that we have some kind of contribution. We'll go into the list of those community investments later on in the presentation. So there are currently 93 Lane County projects included in the CIP project or CIP plan. And those include within the standard projects and the pre-planning projects, projects from facilities. So that would be capital planning section, roads, technology, and solid waste. So as you see from the charts here, the 5-year total expenses for the standard projects is $117.3 million. And you can also see from the charts that basically these projects are facilities, which contains infrastructure and construction, which is at 22% of all the projects. And then the rest is the roads, which makes up the majority of the cost at 72%. So projects are funded by a variety of sources. So one is our capital improvement fund. The other one is a road fund. And then we have our general fund. And then we have other funds and other revenue sources. So departments could allocate funds to projects. We also get state and federal grants. ARPA funding is a good example, and some other like the CARES Act funding and so forth. Road fund projects, board approval of the CIP will delegate the contract authority to the county administrator so that road funds or road projects can start right away. So the review process includes that facilities, roads, and technology projects all go through a review, prioritization, and approval process through respective committees. So for the facilities projects, which is construction and infrastructure of our buildings, they would go through the facilities standing committee. For the road projects, they all go through the transportation advisory committee. And for the technology projects, they all go through the technology management team. So back to the community investments identified in the CIP, we have the Veneta Elmira multi-use path, the South 28th dust mitigation, and the low barrier sheltered navigation center, which we talked a little bit about earlier in the board meeting, the housing investment program, and the South Lane Clinic. So we recommend that the board adopt the fiscal year 22, fiscal year 26 CIP, and upon adoption, staff will begin implementation. Thank you for your time, and please let me know if you have any questions that Peggy or I can answer. Thank you.
Thank you very much, Ms. Waite. Ms. Kepler, did you want to add too before I ask commissioners if they have questions or comments?
The only thing that I would add is that the Transportation Advisory Committee has reviewed all of our projects. We go to them on an annual basis. They do review all the projects and move them forward with their recommendations to a public hearing.
Thank you. Thank you. Commissioners, questions, comments? Vice Chair Farr.
Thank you, Chair Bernie. And this is just a general question, and I understand the role of the Transportation Committee. Next Tuesday, this body will be approving the appointment of 4 new Lane County Planning Commissioners. Can you tell us a little bit about how does the Planning Commission enter into the development of the CIP?
They actually don't participate in the review of these construction projects. They do receive any land use applications, and they have our Chapter 15, which has our road standards within them. So that would be their only involvement with the road development.
Exactly. Thank you for stating that their work comes prior to the development of the CIP, and their work is more policy recommendation as opposed to direction on specific projects. Thank you.
Correct.
Thank you, Vice Chair. Other commissioners? Yes, Commissioner Buck.
I was going to move the order if that's okay with everyone.
Oh,
right,
even if it's not, Commissioner Buck, you go right ahead.
I'll move approval of order 21-08-24-06 as presented.
Is there a second?
I'll second.
Thank you. Thank you, Commissioners Buck and Trieger. Commissioner Buck has moved and Commissioner Trieger has seconded approval of order 21-08-24-06. Is there further discussion to the motion? I have a question, Ms. Waite. In all, why are you laughing? I'm not going to. So within this 5-year CIP, and I do notice about 22% is going to capital projects and the vast majority to road projects. Can you give us, and if you can't, perhaps later you could, but I would be interested in a breakdown of the 22%, the capital projects, under our current criteria for community benefits. You know, what the dollar number of those projects that are in this, and then I know you're planning to bring to the board at the right time when you have all the data that you need, the possibility of lowering that limit from $1 million to $500,000. And would that impact that at all? I'm just looking for numbers for that particular community benefits application. Do you happen to have that?
Yeah, thank you, Chair Bernie. I don't have that rate at my fingertips, but I can provide that breakdown. I'm going to say most of our projects that are in the CIP are over that $1 million threshold. I do plan on coming back to the board probably late September with a recommendation and request for approval to lower the threshold on our community benefits and have discussion on that.
Okay, well, thank you very much. Ms. Waite. I'm sorry, commissioners, you have to understand, I probably overburden Ms. Waite, and so I'm not used to calling her Ms. Waite, but I'm trying to observe protocol here. Are there any other comments or questions? Seeing none, I will call the question. Order 21-08-24-06, moved by Commissioner Buck, seconded by Commissioner Trieger, in the matter of adopting the FY21-2 to FY25-6 Lane County Capital Improvement Plan and delegating authority to the county administrator to execute contracts for road and bridge projects with terms less than 10 years. All those in favor, please signify by saying aye.
Aye.
Opposed, same sign. Let the record show that order 21-08-24-06, moved by Commissioner Buck, seconded by Commissioner Trieger, has been unanimously approved by commissioners present, 4-0. Commissioner Bozovich not here. Thank you very much.
Thank you.
I do not believe we have executive session this morning. I know we have it this afternoon. Is that correct, Diana?
That is correct.
Thank you. Is there any other business from commissioners before we recess for lunch? Seeing none, thank you.
Chair Bernie?
Uh-oh, what did I do? Yes.
We did have county administration announcements on there if you wanted to get to those before the rest of the meeting.
You're so polite. Thank you. Everyone is so polite. I missed that. I apologize. Steve or whomever, are there announcements under county administration?
Thank you, Chair. I think just the one that I would share with the board is there was an assignment made 2 weeks ago after we had sort of gone back and forth about you had approved the emergency public health advisory. We then heard during that meeting that the governor was going to announce and has subsequently announced a statewide indoor mask mandate. The board then asked that we send a letter to the governor of appreciation for that. That letter has not yet been sent. And of course, a lot has transpired over the last 2 weeks. You just approved a new emergency public health advisory. And there's been a lot of sort of back and forth, and I know concerns about the governor's comments about the role of local agencies and response to that. And so I just wanted to, before we, I think our reflection at the staff level is that things are changing so quickly, almost really on a daily basis, if not several times a day, things are changing. And so I just wanted to check in again to see if the board feels it's necessary to provide that that letter to the governor, or how you would like to proceed.
I see Vice Chair Farr's hand up.
Thank you, Chair Bernie. And Ms. Mokrowski, thank you for bringing this up at this particular point in time. If nobody's had a chance to read it, I'm sure we all have. Earlier this week, Chair Bernie penned an op-ed in the Register Guard addressing specifically the relationship of local governments with the governor and the governor's some of the governor's comments. We all support the governor's. I support the governor's actions, and we all, at one level or another, support the governor's actions. I believe that Chair Bernie's op-ed really covered some of the basic points of an interaction between the county and the governor, and how to further enhance the governor's ability to gain full support of her actions. So if the op-ed that was written by Joe Bernie, I personally am fine with making that an op-ed or a commentary by the Board of County Commissioners at whatever level we can do that. That's open to debate, but once again, the points that are covered by Chair Bernie in that letter really do cover some of the things that really, I think, can be very adequately, they can adequately sum up some of the issues surrounding the governor's actions. It also, the last thing I'll say about it, if you read it and when you read it, there's nothing controversial or challenging or critical of the governor's actions, just recommendation for better or for further coordination. So with that, Chair Bernie, thank you for that letter, the op-ed, and I'd love to hear what other commissioners think about that.
Well, Vice Chair, before you were through, Commissioner Trieger had her hand up, so Commissioner Trieger.
Thank you. As the one who asked for the letter to be written, I think I agree that the situation is changing. I did see the op-ed, and it seemed one of the points in it. I just think we need to not get down in the weeds because things are changing, because we really do need a coordinated effort from the local to the state to the federal, and in fact the national, international level around this pandemic. I think the more we get into a did to, did not, or who is saying which level of government should or shouldn't be doing more or moving faster or moving slower. I think if we're not going to send the letter that we agreed already we would send, thanking her for taking action on instituting a statewide mask mandate, that we could at least send a broader letter, just indicating our willingness to be good partners in pursuit of the best answers for public health and safety for everyone in our own community, statewide and nationally. And that we just zoom it out a bit and just make that commitment. I think there's an assumption earlier in the pandemic, there was conversation about wanting the governor to back off from statewide mandates and letting locals have more control. And I think many people who felt that way made the assumption that meant that we would be less restrictive at the local level, when in fact, local control means local control, and we can be more or less restrictive than any statewide mandate. So I think rather than getting into the particulars of all these things, generally is a good practice, but especially with things moving so quickly, I would support us sending a more zoomed out letter, just indicating our willingness to be good partners and to do everything we can in cooperation with our state and national officials to bring an end to this pandemic.
Is there anyone else that would like to speak to this? Commissioner Buck.
I suppose that would be me.
Yeah.
I'm fine with a more wider ranging letter. There is a lot going on, and it's not just one thing or one item that any agency or locality is doing at any given point in time. It is important, I think, to give feedback that, not all counties are made the same. We all know when you see one county, you see one county. And we are unique, as is any other county, and we are doing our very best to work with all of our agencies, all of our governmental agencies, as well as with the public, to be as transparent and open and get services out to folks as soon as possible. So I'll just lend my support to that broader letter as well.
I guess I'll speak. I see at this point in time, so much has changed. Personally, I don't see a reason for spending time writing a letter, but that's just me. Let me just share that the headline that I proposed to the Register Guard was "Lead with Grace for Unity, Not Blame for Divisiveness." And I would like to just share with the board the reason that was actually done with full knowledge and input from some of our key county staff. And what you didn't see was Chair Commissioner Buck saw this when she went to these regional meetings with county chairs and the governor. But what you didn't see was how strongly the governor knows Lane County supports these activities and how much we supported at the time 2 weeks ago a state level indoor mask mandate and all the reasons for that. And in fact, we were creating 2 weeks ago, if you recall, this advisory in the context of there wasn't anything. And if anything, that contributed to the creation of that. Now, subsequently, this thing is growing and it's just surging. We all heard the details. So the intent of that was more like to try and give the government, and I spoke to her directly about this, a sort of a clean slate, because the resentment from some of the more rural communities that were pushing back against any kinds of guidance at the state level was so strong. I was just trying to contribute to a clean slate so we could all start moving together. So anyway, that's just a bit about that. But as it relates to a letter for an indoor mask mandate, when we are seeing so many requirements and the healthcare community pushing the governor to do more, which she has, do you really think it's timely for that or even needed? That's my question. I would ask that, please, Commissioner Buck, and then Steve, if you want to weigh in, but please, Commissioner Buck.
I think our state leaders like to hear from us. I know that you, and I totally get that those conversations with county leaders happen quite often. And that's great because they need the feedback. But sometimes it's important for the public to know that we are giving the feedback to the state as well, or our other leaders within the state. They're not always privy to those, private conversations.
Right.
So because of that, I would think, it's still good to do. And it really wouldn't take much effort.
Any other input on that? Steve, you have any input?
I think if there are 3 head nods to do that, that's certainly fine. We can, I think it makes more sense to send a broader letter, kind of as articulated by Commissioner Trieger, asking for collaboration, kind of these broader themes that we've seen. Then, and I think our concern was like, well, and I'm sorry that it didn't. There's just so much happening, and our bill. And I know the board is always well intentioned in wanting to do these things, but it felt like the moment had sort of passed, and so that certainly makes sense. We can draft that letter, and I think we're also trying to just manage staff time, on these matters. But I would agree with Commissioner Buck. I think that state leaders like to hear from the board, and this is a broader theme. If you would like, and if there are head nods for that, we certainly can draft a letter, and maybe we put it on the agenda for next week for all 5 of your signatures. And it's kind of, then it stands for the record about, call for collaboration and coordination around all these matters. So I guess I'll just look for if the question is to draft that broader letter and bring it back for the commissioners to sign on to in lieu of the letter regarding masking to the governor, then I just look for 3 head nods. I see 2 commissioners that are supportive of that.
Oh,
So I'll cover that under review assignments. Thank you. 2 other quick things, if I may, Chair, really quick. The question was asked, Commissioner Farr asked under the COVID update, and I just provide a little more information. I can send this to commissioners, that we have developed the question about remote work. And what's the and I think Commissioner Trieger asked about this as well. What's the process that we go through? We've created a guide for supervisors and managers to use to determine, what factors they should be considering about whether an employee should, qualifies for remote work and whether remote work works well there. So those are sort of, you asked about equity and sort of equal treatment, even understanding that everyone's job is different in the organization. We have that that guide that I'm happy to share with you. The other question that Commissioner Burney has asked me, and I'm just going to take the liberty to share with commissioners, that we will be having a discussion next week with the board. But Commissioner Burney has asked, and others have asked about vaccination or testing requirements for employees in Lane County, and that is something that we are considering. We're looking at that very thoughtfully. We understand this is not this requires review and analysis and consideration. Any practice that we would potentially put into place would need to be discussed with the various bargaining units. We have 8 bargaining units in Lane County, and we would need to discuss the impacts of any requirement with those bargaining units. So there's a process there. We have not landed on a decision, and we will bring to the board some options and recommendations for you to consider as part of an executive session next week. But I just wanted to share that that is something that we are giving thought and analysis to, but no decision has been made.
Thank you, Steve. Steve politely covered for me. I told him in agenda setting I was going to bring up that question, and then with all that's occurred, I didn't. But what also is interesting, if we get deeper into this, is looking at the contracts that the county has for purchasing, and how, in fact, we can't use that leverage to try and increase the potential herd immunity that we're trying to achieve, as Dr. Ledke said, which is the only way we're getting out of this. So anyway, thank you, Mr. Mokrahajski. I think that's covered county administration announcements. Do commissioners have other business at this point? Yes, I can barely see your hand, Commissioner Trieger, and my screen. Yeah, there you go. Yes, Commissioner Trieger.
Just a point of process question. Will we not have a commissioner's business announcement and future board assignment requests on our afternoon agenda?
Do we not have that?
We do. It's written on there, but I just wanted to clarify that it's still on there. You're just asking for the morning, not for the meeting in total, correct?
Correct. Yes. And Commissioner Trieger, you are correct. It's item 12 in the afternoon before we go into executive session.
Thank you.
In that case, have a good lunch. There's lots more to come. We will reconvene at 1:30. Thank you all very much.